one of you. It is both an honor and a privilege to stand before the distinguished gathering as we convene for the 6th Annual Healthcare Management Conclave organized by the Goa Institute of Management in association with CAHU, the Consortium of Accredited Healthcare Organization. This conclave is also a pre-summit event leading to the India AI Impact Summit 2026, which will be the first ever global AI summit hosted in the Global South. On behalf of our faculty, staff, and the student community, I extend our deepest gratitude to our esteemed speakers, the industry leaders, and all the delegates who have joined us today. Your presence here reflects not just commitment, but conviction, a shared belief that the future of healthcare will be shaped by those willing to envision it boldly and build it collaboratively. Before we formally commence today's proceedings, I would like to invite the distinguished dignitaries, Professor Ajit Parulekar, Director of the Goa Institute of Management, Professor Venkatesh Naga, Dean of the Goa Institute of Management, all the speakers present with us, Professor Shirupa Sengupta, Program Chair of the Healthcare Management Program at GIM, Professor Praveen Pradeep, Associate Professor of Healthcare Management at GIM, and Shorbajit Rai, second-year student of healthcare for the Healthcare Management Program, to grace the stage for the ceremonial lighting of the lamp and formally inaugurate the event. Thank you all. May I request Professor Ajit to please kindly remain on stage for the welcome address. Please take a seat. Healthcare today stands at a defining crossroad. As we look towards the year 2030, we are witnessing the intersection of incredible technological progress and an urgent humanitarian need. The real question is not that if healthcare will transform, it's how we'll shape this transformation to be inclusive and equitable. Our theme for today's conclave, Envisioning Healthcare 2030, Technological Breakthroughs and Business Innovation, captures this moment perfectly. The world is at the precipice of many technological innovation, but we are reminded that technology alone is not enough. To fulfill healthcare's promise, we must also rethink our business models. The focus must move from what's possible to what is accessible. Today's discussion reflects these two dimensions for the future. Our first panel, Care Revolution of how AI and advanced technologies are redefining patient treatment, will explore how AI, genomics, and predictive analytics are driving precision and prevention, and what operational, cultural, and regulatory changes must follow. Our second panel, Democratization of Healthcare innovative models and technological advancement for universal access will focus on ensuring these breakthroughs reach everyone. We'll discuss scalable innovations, partnerships, and models that balance quality, cost, and access. Let me take a brief moment to walk you through the exciting day. The momentum for the conclave was actually set in motion yesterday with the pre-conclave workshop on AI for healthcare delivery in India, from hype to safe, useful practice, where speakers like Ms. Mili Budhiraja of Vadhwani AI, Dr. Rakesh Biswas of Kamineni Institute of Medical Sciences, and Mr. Swadeep Singh, who will join us here today, offered practical insights on building trust and readiness for AI adoption in healthcare. After our inaugural addresses today, we'll hear plenary addresses from Mr. Joy Chakraborty and Mr. Swadeep Singh, two leaders who are just witnessing change in healthcare but also driving it. Following a short break, our first panel will bring together experts from Apollo Hospitals, Samsung, Pulse Pharma, and Hinduja Hospital for a dynamic discussion on AI-driven care revolution. Post-lunch, our second panel will feature founders, researchers, and public health visionaries who are reimagining healthcare accessibility across diverse settings. We are especially honored to have Dr. Devi Shetty, founder and chairman of Narayana Health, delivering the keynote address at 3:45 p.m. today, sharing his insights from one of India's most visionary healthcare leaders. Due to some pressing prior commitments, Dr. Shetty will be joining us virtually. We'll then wrap up with a closing ceremony, followed by a high tea. With that, let us now formally commence today's proceedings. With great pleasure, I invite Professor Ajit Parulekar, sir, Director of Goa Institute of Management, to deliver the welcome address.
Yes, so good morning, everyone. I can see that Dr. Joy has also arrived. Good morning. Yeah, good morning, everyone. I thought I'll first use this as an opportunity to talk a little bit about the Goa Institute of Management for the benefit of our speakers and guests from outside. So the Goa Institute of Management is now we are now in our 32nd year of operation. We moved to this campus in the year 2010. Just, I think, earlier this month, not this month, I think late last month, we got accredited by AACSB, which is the top accreditation worldwide. This is the American Accreditation for Business Schools. We join 1% of business schools worldwide to be accredited by this accreditation. We also, we're looking at a re-accreditation, news coming anytime now for the next 5 years for the UK accreditation, which is AMBA and BGA. And therefore, I know that Kaho is our partner in the B school, circuit. We carry the top accreditations worldwide. Of course, all our programs have national accreditation. Our student character is national in the sense that we have students coming from almost every state in the country, very hotly contested, expectedly for a good, school of management. Every year we admit 660, this year we admitted 660 students across our 4 full-time programs with over 25,000 applicants for the 660 places. We have a very large, reasonably large, diverse, very talented faculty. Some of them are here today. We have 93 full-time faculty members. A lot of them live on campus, and you'll get to meet some of them, as the day progresses. And we think we are the pioneers amongst business schools in the country, schools of management in the country, to have started a program exclusively looking at management of healthcare. And this we did in the year 2013. Today, there are several more institutions that do this, and we think, and I'm sure we have so many leaders from healthcare, I'm sure you'll agree that, this is a sector that's quite unique, and if you have, management that is specifically addressing this particular sector, you will get a good pool of trained professionals here, because we've been doing it for now well over a decade. We have now our own set of healthcare leaders that are there across, different parts of the spectrum. Primarily, working in consulting, working in healthcare IT, health policy, medical devices, pharmaceuticals, relatively lesser in hospital, but in hospitals too, and literally public health, almost the entire space. Because when we look at healthcare, we look at it as healthcare, life sciences combined, keeping the patient at the center, and everything that affects patient welfare, we include all of that as part of our programs and curriculum. The last point, and I think, after I complete, so last point before I get into my welcome address is about the institute is that we do a lot of work on health systems in the country. We've just started a Center for Health Systems. Work has been done for almost a decade on health systems. We decided now it is large enough, the body of work is large enough for us to have a dedicated center. When you have a dedicated center, what happens is you can attract faculty specifically for that particular center, as well as funding and things like that. And therefore we've done a lot of projects across many states in the country. Professor Khea will speak, Professor Khea Furtado will be speaking after I complete my welcome address and give you an overview of some of the work that our faculty will be doing in this space. With that, let me, once again welcome our distinguished speakers, our faculty colleagues, a couple of alumni, students and friends. My pleasure to welcome you to the 6th edition of the annual Healthcare Conclave. I think we've come a long way, both on the healthcare program as well as on this conclave. And today's conclave, as like every year, we try to make sure that we're doing this conclave so that we are seeing what is current, relevant, and futuristic is what we are bringing for conversation so that our students, faculty, as well as industry can benefit from this. And today, we are going to have this conclave that's going to have speakers that are coming from, from hospitals, from public health, from pharma, from med device, from policy, from outside, specifically from AI, startups, from all of this, and therefore I think it's going to be an exciting conversation. This year's conversation is also going to be a lot more different because what's happening in healthcare is extraordinary, not what's happening this year alone, but it really looks at what's been happening over the last 5 or 6 years and what's likely to happen in the next 10 years. And that's healthcare being driven by technologies such as AI. I won't call it artificial intelligence because I think the right way, there's a new emerging way of looking at it. Digital technology, data, and a lot of other supportive technologies. This is resulting in a massive change in the way that we are diagnosing, the way that we treat, and even the way that we just think about well-being, disease, all of this. So if I have to look back, so I was born in the previous century, still spent more of my life in the previous century than the current century. It's going to tip in a couple of years. I must just say that the 20th century was phenomenal for healthcare. And when saying phenomenal for healthcare, in the 100 years in that century, you found that the, so to say, average life expectancy at birth has had a quantum jump. It's not just marginally increased, it's been massive. And success for that success came primarily because of things like antibiotics, vaccines, surgical revolutions. I'm quite happy because, my background is pharma, and you can see a lot of that also came from pharma. And today what's happening, the 21st century is of course being revolutionized by things that are completely outside all of this. It's the age of algorithms, age of data, age of robotics, age of digital networks. And I think that's really exciting. And now there are forces that are defining healthcare that were never seen as being part of the healthcare industry. And I think that's where most of our conversations are going to be about. What I'm going to tell you is very basic. The speakers are going to tell you a lot more advanced stuff, but today that AI is reading everything. So, whether it is reading X-rays, MRIs, the kind of accuracy level is going up really fast. I know that today we have, some of our faculty who are, working as part of the data analytics part. They don't have any background in healthcare, but today they are able to do so much more in terms of looking at, pathological specimens, looking at radiology data, and be able to do stuff that, a medic would have found it difficult to do. And I think that's really where you find that there is a lot that's happening. Anything, diabetic retinopathy, how you can kind of, detecting stuff from data that is not seen, clinically where we don't have evidence as yet. You can just pick up data and look at, run correlations, and based on that you'll be able to find patterns that current medical science is not able to, to be able to find on its own. It's also getting democratized. So I have a wearable. I've been wearing a wearable now for, I think well over a decade now. Of course, there's a worry. Some people get stressed by it because it's constantly giving you data, and therefore I understand. But you have stuff that you can get today done, which is not only things like wearables and your phones doing so much on your healthcare and what's happening there, but also in terms of a lot of stuff that you required to be invasive earlier, it's non-invasive today. Right? Today you can do a lot of stuff doesn't require a prick to be done, doesn't require a sample to be picked up, and you can get even monitoring. I mean, just thinking about diabetes, hypertension, all of these, your monitoring was based on certain transactional events. You know, you would do a fasting blood and you would do a PP, and you know, all that. Today you can get so much more data if it's going to serve a purpose. And I think that democratization is something that's becoming interesting. On the manpower front, you find today there are bots that are available, there is AI technology that's available, that at least for the basic stuff, let me not say healthcare, let me say more on the well-being side, at least it should be able to do a lot of work that's otherwise going to be expensive, inaccessible, and difficult. And therefore, it's going to add on to the role that the entire healthcare industry has. It's not going to replace clearly, because what a bot can do is limited, however good that bot becomes. Because, you know, when you hear something from, if I have to give you a message, if this message was not read out by me, and if I just had something that I'd say, you know, ChatGPT is going to read out this message out to you, you're not going to receive it in the same way. And the same thing happens with healthcare providers. It depends also not just what is done and what is said, but who does it and who says it. Yeah? And therefore, things like access, I can see the promise. I'm saying I can see the promise. I'm being a little skeptical, because I know that technology is allowing, you know, remote medicine to happen, telemedicine, and so many other things. But I'm just hoping that, you know, barriers of profitability don't come in the way, that access will have to be, you know. So today we look at, I just say, you know, if you want to use Gen AI today, there's a fee to using high quality Gen AI. There was no fee to using internet search engines. And that's part of the worry I'm thinking about. You know, if it starts getting monetized and starts getting largely consolidated, access should not really be the one that gets sacrificed. And this revolution that we are you know, witnessing in terms of access, in terms of democratization, I hope it's able to realize the potential that we are seeing in here. India is a good place for this. In some ways good, in some ways not so good. I mean, you know, some of the conversation that we're having on the sidelines with some of the speakers, the place that it is good is, you know, the democratization journey. I think India would have a huge role to play. And why I'm saying this, for any innovation, India's role so far worldwide has been in democratization, which means really making that innovation frugal and inexpensive. And that happened in every space. So if you look at really pharmaceuticals, the lowest cost of medicine in the world is in our country, right? We didn't invent the stuff, but we invented the way to make it less expensive. Exactly the same thing is happening in high quality med devices. So today you look at, you know, the least expensive anything. I mean, ECG to stents to X-ray machines to Holters to whatever you look at, the least expensive ones are really happening in India, and high quality. You look at cost of delivery of any surgical procedure in the world, the cheapest is going to be, cheapest is not a good word, the most economical and efficient is likely to happen in a country. And I think therefore for democratization, this is the country that the world will look at. I'm hoping that it's not going to be only democratization, it's also going to be cutting edge innovation. That's a place we've not been there. So new to the world is something we've not been able to do, but that's what I'm hoping we're going to be able to do. So why else is India good? Because you find the ecosystem is working well. So in the ecosystem I find, you know, today what happens is today technologies are not limited to a domain or an industry or a sector. They cut across. And therefore what you need is convergence has to happen. You have to happen that, you know, at the right time, your quantum gives you computing power at that time when you need it. It can't happen if you're ready for it, but the computing power is not there. But if your computing power is ready, do you have the data available at that point in time in the way the data should be? Yeah, so you will have to have, you know, Aadhaar happens, ABDM happens, you know, Sarvam AI is coming in, Bhashini comes in the other side. All these have to be timed well enough so that you can get, you know, an additive effect on all of these. And I think that's what's happening in India. You know today that ABDM some years back was a talk, today it's a reality. We have over 1,500 top healthcare, you know, health tech startups and doing work across the different kind of, you know, spaces that are available. And I think that adds on to the same kind of ecosystem. Today, I did say already that med devices you find are becoming less and less and less expensive, and as they become less expensive, accessibility just becomes, you know, terrific. Today, let's say your smartwatches, you can get a smartwatch at $1,000. And I'm not saying a low quality, a high quality smartwatch. It may not have the same fashion quotient or the brand kind of recognition and status and stuff like that, but it delivers equally good on the technology side, and that's happening across all spaces. Yes, I think that's really what's good. Let me just kind of, I'm approaching my time, so I'm going to talk about what are the opportunities and what are the kind of challenges. I'm going to say the first opportunity I see is today data is the new drug. And I think if you use that well, I think the kind of stuff that you can do is phenomenal. The quality of data in India was something that we talked about some years back, saying that there's a lot of data, but it's not in a way that is usable. But that's changing today because data is getting captured. Humongous data is getting captured in a way that it is usable, and therefore this is cleaner, this is more contextual, and of course we have to make sure that the use of this data is ethical. You know that all of us are terrified all the time that every device around us is able to pick up whether we want it to know, even if your device is switched off, and therefore that ethical use is something that when the data is a new drug, that's one part. The second thing is precision medicine is something that's been talked about for a long period of time. I still don't see it as much happening, but I do see clearly the promise of precision medicine on every part. So precision medicine in terms of precision med device, precision pharma, precision, in terms of the data, diagnosis, all of that, and I think that's the second opportunity. The third opportunity I see is virtual care. Accessibility is really going through the roof because of telemedicine. I'll broadly call it telemedicine, but all these technologies coming together. I think this technology, so if you find suddenly, when I'm saying technologies, if you required earlier that a sample had to be picked up, that was a biological sample, you suddenly found distance and access became a challenge. And if it then get replaced by, let's say, an optical sample or by a scan of the face, you suddenly find you can do it remotely without any cost addition. And therefore I see that there is a lot of promise of virtual care which is going to make possible true access. And fourth I'm saying is collaboration really is going to be the key. Because as I said, that this is not going to be, this is not going to come from one industry, one company, one sector, one technology. This is primarily going to be everything kind of coming all together. Whether you're running a hospital chain, whether you're running a pharmaceutical company, whether you're doing med device, whether you're doing insurance, whatever you're doing, the forces that are hitting you are not from your industry alone, they are primarily from outside the industry. And you can't master all of this stuff. So the way is really going to be collaboration. What are the challenges? I'm sure all of you know many of the challenges. Let me reiterate some of them. The first is data privacy, consent. And that's the consent part, and data privacy is really going to become more and more and more important. The second is bias. We all know that, the kind of data that, so today if you look at what are the worldviews you're forming, it primarily is, so you can just look at, if you just look at anything, you look at the reels that you're getting. If you do a content analysis of the reels you're getting, it will tell you about your personality. That's what it is. So if you're getting, if you're getting reels that are about communism, you are a communist. If you're getting deals which are about, empathy, then it seems that empathy and you go hand in hand. And I'm just saying one or two things. There are a lot of devious reels that will also come that will tell you things about your personality, but that's really what's happening. That we are not selecting media. By and large, if you're in a passive mode, media is selecting you. Information is selecting you. And I think that's the thing that you have to be very careful about, is that when you're doing analysis, we're looking at solutions, when you're putting money behind a particular solution, be clearly aware that, like as an academic, I know most academics hate doing evaluation. If you have AI taking up your evaluation completely, doing a job that's as good as you, hey, why not give it up? Yeah. So all of us have jobs that we are not as excited about, but they're an integral part of what we do. And if you find AI is going to do it as well as you, I'm happy to have AI do that part for me. And I just took an example of assessment because students can relate to it, but there's so many other things that all of our jobs have. Documentation, by and large, there are relatively fewer people. A doctor does all his work and then he's got to get all the records put in place. Nobody likes keeping the records and all of that. They want to outsource to somebody else. Nobody likes it to be outsourced to them unless they don't have a skill set better than that. And therefore, that's one. It's important to make sure, therefore, that human touch stays. It's important that, if you're doing an appraisal rating, if you're giving feedback to a customer, if you're telling a patient about their diagnosis, it's important there's a face, there's a human face to it, there's a human touch to it, there is emotion to it, there's empathy to it. Because if there's empathy to it, then you're not in healthcare. You're not in well-being. Then what you are is, you're just looking at profitability, single stakeholder, investor, that's all. you should be treated therefore as a trader and a dealer, not as a healthcare professional. Yeah? So the human touch is an important part. And fourthly, is making sure that access happens. Because, you know, technology can be a great enabler, but technology can also be the great divider. And therefore, it's important to make sure that when you're doing all of this, at all this point in time, and it's not about healthcare, it's about education for us. What we also see is that our country has ambitious plans to move the gross enrollment ratio from, it was 26% at the time they wrote NEP, now it's around 30%. From 30% to 50% is not going to happen in the same model. It's not going to happen that kids like you will be able to come to the Goa Institute of Management, spend 25 lakh rupees on the program. If you're going to do that, it's going to be only 1, 2, 3% of the population. If you're going to have everybody do it, it should be possible to be able to do it at affordable costs. And affordability will only come if the cost of delivering is going to come down. And technology is where those answers are. And therefore, I hope that access goes up, doesn't reduce because technology can become a barrier. Technology per se is agnostic to it. It just depends upon how all of us as leaders in different organizations are able to access this technology to be able to do this. I also thought that since, you know, we have our faculty here, what is the role of academia and research? And I think, you know, the moment you have a lot of these complex phenomena coming, researchers are excited. Because simplicity and research don't go hand in hand. Complexity is a place where you get an opportunity to unravel, and therefore I think this kind of complexity coming in, there's a lot of opportunity for our faculty here at research to look at multiple things on how technology can play a role. Please also be aware about technology bias, technology access, technology ethics. I think these are things that we should be looking at. Our researchers currently do work, you know, across different domains in healthcare. We're very happy we can get access to data from your respective companies. We'll be very happy to collaborate because I think that's really the way forward. For our graduating students, this is a terrific time to be in healthcare. And I know, you might be thinking, I'm sure every speaker will keep on saying it's a terrific time to be in this and that. I can just tell you that all your speakers, and I can see, I have not yet seen too many of your, except for, the health startup kind of folks, they're really young. They're half the age of the other speakers here. Other than that, all of these people will be able to tell you that when they joined healthcare, when any of us joined healthcare, healthcare was not sexy. It wasn't. No politician in India till in the last century won an election because of a healthcare promise. And today what's happened is no politician in the country can ignore healthcare. And that's why I'm saying it's a great time to be in. It's a time when you find now it's, a decade has passed since you had Ayushman Bharat talked about. Today you find that, so many things that we heard is going to happen sometime in this country. A lot of that is happening. The money that has to come into healthcare from the government, that will still go up. That's still not adequate. But I think that's a great time for you to come in. You will have the opportunity of designing these new systems. You're coming from a top healthcare management program. So you're not going to be someone who's going to see it happen and somebody else is doing it. You're going to have the opportunity to design this stuff and to be known for designing this stuff and shaping the future of healthcare, which is shaping the future of our country. But please understand this, that, as an institution that promotes responsible leadership and management, make sure when you're doing this, you don't have an eye only on one stakeholder, not only the shareholder investor, but you look at multiple different stakeholders. Ultimately, whether it is AI, robotics, genomics, all of these are tools. What is our ultimate objective is to change, transform human lives. Please keep that as the center of your attention. If that's your center of your attention, I can tell you that, we just had, a month back, we had Professor Ed Freeman here. He's the father. In 1984, he came up with this whole multi-stakeholder theory, which has resulted in, what ESG you see today and sustainable development, that's part of it. You're also getting this year another, we just spoke to Professor Raj Sisodia, who works on conscious capitalism. Basically looking at what's the purpose of all of this. And you know what all the data shows? All the data shows that if you're conscious, if you're doing things that are good for customers, good for employees, good for the world, those are companies that are more profitable. If you choose only profitability, you're going to get you may get one side of, so you find companies that look at only profitability, they are not as profitable as the companies who look at being, doing good to society. So I'm just saying that that's what we'd like you to be, and therefore in that way contribute towards Viksit Bharat 2047. I thank our faculty, our students, our distinguished speakers for taking time to be here. Look forward to a day of learning, reflection, inspiration. I only have to also, I'd ask forgiveness from some of our speakers. I'm not going to be there for the entire day. I'm going to be off and on. I'm here on campus, but AI is not important for only one industry. It's important for all the other industries. Today, what we also have is we have a 1.5 hour session for our faculty on how AI will transform education, higher education, and GIM. And there were some of us who will step out for an hour and a half. We really look forward to the conversation that are happening here. Thank you so much for taking your time. God bless.
Thank you, Professor Ajit, for those inspiring words that set the perfect tone for our discussions today. One of the hallmarks of any great institution, it is their ability to not just respond to change, but to anticipate and drive it. In healthcare education research, this means building infrastructure that connects academic inquiry with real-world impact. I am delighted to introduce Professor Kea Furtado, Associate Professor of Healthcare Management and the Center for Health System Design and Management at GIM, who, as Professor Ajit has already mentioned, will share insights on healthcare research at our institute. Professor Kea Furtado is an associate of the Lakshmi Mittal and Family South Asia Institute at Harvard University and a 2023 Bajaj Visiting Research Fellow who specializes in health systems financing, public health policy, and universal health coverage. A fellow with the Lancet Citizens Commission on Reimagining India's Health System, she has led projects which was funded by the WHO, Alliance for Health Policy and Systems Research, the Gates Foundation, and Harvard University. Formerly with Niti Aayog's Health Division, Professor Kea has contributed to initiatives such as the Niti Health Index, the 3-year action agenda of the Government of India, and District Hospital Index. Her work bridges policy and research to strengthen India's health systems. I now request Professor Kea ma'am to share the research at HCM.
Thank you, Vaishnavi, for that kind introduction. It's strange to be introduced in your own home institution. Very good morning to all of you and welcome once again to GIM. I have the privilege of talking to you a little bit about the work that the healthcare management faculty at the Goa Institute of Management do. This is just a little glimpse, and I'll talk about a little bit about the work that we've been doing over the last couple of years and how we really plan to consolidate and take this work forward. So over the last couple of years, the GIM healthcare faculty have led a growing portfolio of policy-relevant research across various themes and dimensions that I'll talk a little bit about. Our work in health systems has been impactful in that we've contributed to 6.5 crore in research funding over the last 5 years, about almost 60 peer-reviewed papers, 17 sponsored research projects, policy briefs that are for the Government of India and the World Health Organization, and more than 50 conference presentations and invited talks. This is across our areas of expertise. This is just our core healthcare faculty. As Professor Ajit said, we have 90 faculty at the Goa Institute of Management, many of whom also teach on the healthcare management program. And what I'm talking about is really just the core health systems work that happens, and a lot of us work in collaboration with the other faculty, many of whom are here present today. I'll talk a little bit about the areas of expertise in a little bit. This impact really also goes into the organizations we work with, whether it's in terms of our research collaborators, our funders. We work very closely with international organizations, as you can see, the WHO, the Alliance for Health Policy and Systems Research, the National Health Authority, for whom we are an official research partner, Harvard University, the German Institute of Development and Sustainability, the Gates Foundation, Access Health International that works a lot in health systems, the Medical Research Council, the World Bank, and more locally, the Goa Institute of Public Administration and Rural Development. So what are the areas really of thought leadership that we've been trying to build over the last couple of years? So the first area is really chronic disease management that I'd like to talk about. Here we have Professors Ajay and Praveen who bring their expertise to this area. They've been working many years. Last year they won a large project of about 2.6 crores from the Alliance for Health Policy and Systems Research, which is hosted by the WHO. And this really looks to set out a roadmap for adult vaccination in India. Professors Ajay and Praveen have worked for long on chronic disease research, diabetes, epidemiology, all of that. So, this is really just a few of their publications. There's a lot more, but just to give you a sense of the work that we do. The next area is health financing. We've done a large, I think the largest number of projects in this theme. I lead these projects, but work very closely with Professors Arif and Nafisa. My area is health financing, and so I bring that to the table, and Professors Arif and Nafisa bring their expertise in hospital management. A lot of these of these projects are really around the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana that you're all familiar with, and we look at financing mechanisms in Ayushman Bharat, purchasing models, looking at how these compare with global models of purchasing, the role of insurance companies, and how they perform compared to government purchasing. So we've done a bunch of projects funded by the WHO, but led very closely with the National Health Authority, who really drives the research questions in this area. We've also looked at integration of publicly financed insurance schemes, not only for India, but for low and middle income countries. And our work has been published both in peer-reviewed papers and as reports of the WHO, which we have co-authored. The next area is the quality of care. These projects are led by Professor Arif with his areas with his expertise in quality, and again we work collaboratively and bring our various pieces of knowledge into these projects with Professor Nafisa and myself. Also doing the projects. Some of these are around PMJ. Some are looking at really what is the uptake of quality accreditation in these schemes. How do hospitals respond to these financing mechanisms? So it's really looking at the first few steps of value-based care. Really, we've not really gotten there, but the first few steps of how we can link financing to quality. So this is from a policy perspective. And then we have Professor Sean, who looks at quality more at the facility level. So really measuring quality in healthcare, in hospitals, and also looking at frameworks for patient satisfaction in healthcare. We then have digital health technologies, which something we're talking about today, and is also an area in which we've done quite a bit of work. So these are projects that the three of us have done independently. I have a project with the Harvard University and the Gates Foundation, which looks at digital financial payments to frontline health workers. Professor Ajay has worked a lot in this area with mobile health applications, developing, testing them. Professor Praveen has looked at work on deep learning models for diabetic retinopathy. So different kinds of projects, but all sort of aligned in theme of digital health technologies. And as you can see, we have a whole bunch of publications as well. Again, this is just a glimpse. There's a lot more. And Professor Sri Rupa's area is really gender health and climate. She also works collaboratively with the faculty, not only in healthcare, but across GIM, including Professor Divya, who's here today. And looking at things related to the role of women in health, but also the impacts of climate change on healthcare. So she's got projects on, mitigating the impact of climate change on the HIV response in India. And so Professor Sri Rupa really leads a lot of, this work. I also wanted to talk about the capacity building we do. So this is really looking at developing, leadership in the pharmaceutical sector, in the medical device sector, where Professor Sean has done a large number of capacity building programs for senior leaders across, very big pharmaceutical and medical device companies. A lot of these capacity building programs are also done collaboratively with faculty across the institute. And so really, what do we see as being the next step to take this work forward? You've already heard that we are looking to launch the Center for Health Systems Design and Management. And as you can see, we're looking to set ourselves apart from every other center, really focusing on systems design. It's not about public or private, it's about one health system and how the various entities and stakeholders can work together to improve global health. So our mission is really to be a leading center of excellence in health systems design and management, dedicated to advancing knowledge, innovation, and evidence-informed policy. We're not looking at just research, we're looking very much at building evidence, and this evidence can be in the form of research, in the form of close community engagement programs, working closely with industry and stakeholders, generating the kind of evidence that's required for advocacy and for policy change. So in terms of our objectives, we're looking at policy-driven research, really, and when I say policy-driven research or, industry-relevant insights, it really means that we have to work in close collaboration with the people in practice, and that's what we're looking to do. It has to be work for practice to inform practice, and a lot of the projects that I talked about are projects where the research questions come from the stakeholders for whom the research is. So we're not doing the research for the sake of research. Publications are just a byproduct, but they're not the intent of that research. They're meant to inform practice. Policy-driven, multidisciplinary research, that's our strength because we have people with various areas of expertise here. Industry-relevant insights. A big focus that I'd like to talk about is that we want to focus on the local health system. We want Goa very much to be a focus area for us. We're privileged to be in this state that has one of the best health systems in the country. It's therefore also a great place to test innovation because it's already pretty well functioning, and to take it to the next level because we compare Goa not to the rest of India as much as we compare it to really other developed countries and small nations. So really looking at how we can support our local health system through the work we do to test models and to look at their replicability in other comparable countries. And so as a center of design and management, we're also looking at developing and testing new design models for health systems. That's going to be a big part of the work we do, especially for universal health coverage, universal access, and financial protection. So our thematic areas will be the areas that we already have expertise in, as you can see, health financing and universal coverage, quality of care, digital tech, and the private sector in health systems, but we're also looking to build our work in climate resilient health systems and pharmacoeconomics. And so really, I just wanted to keep this brief, just to give you a sense of this is what we're doing, but mainly to invite you to collaborate, to partner with us, to take this work forward. We'd like you to, to co-produce the research and the evidence with us. Research that will be for practice, to engage in executive education and capacity building initiatives, either as clients but even maybe as resource people. There's a lot that we can do together in this area, and really to join our growing network of government agencies, academic institutions, and industry leaders. Yesterday we began this workshop with this conclave, with a pre-conclave workshop. For the first time we had something like this, and I was really happy to see that most of our participants were stakeholders from the local health system who actively engaged with the speakers in trying to understand the applicability and adoptability of AI tools in their everyday practice. This is the kind of work we hope to be able to facilitate as a center, to bring the different parts of the health systems ecosystem really together, to strengthen local systems and to take it to the global health community. So that was just the beginning, and we hope that this will be the first step in a long, exciting journey ahead. And so with that, I'd like to sort of close. We look forward to hearing from you. We're happy to hear your thoughts. You know, we're just in the process of launching this center. We're happy to hear your thoughts on, you know, what are some of the things we can take up, we should take up. If you'd like to, we'd love to hear from you. So please do get in touch. We have our website and our email, and we're around today, so we'd be happy to chat with you about it as well. Thank you so much.
Thank you, Professor Kia, ma'am, for illuminating the vital work being undertaken right here at GIM. Before we move on to the plenary address, I invite the dignitaries to please join us on stage. Professor Ajit Parulekar, Mr. Joy Chakraborty, Chief Operating Officer at Hinduja Hospital and Governing Council member of CAHO, Mr. Swadeep Singh, General Manager of Data Science at the India AI Mission, and Professor Shrirupa Sen Gupta, Program Chair of the Healthcare Management Program at Goa Institute of Management. Thank you. I'm honored to introduce for our first plenary address today, Mr. Joy Chakraborty, Chief Operating Officer of Hinduja Hospital and a Governing Council member of CAHO. In his role as the COO, Mr. Chakraborty leads one of India's premier healthcare institutions with a focus on operational excellence, innovation, and quality care. Before joining Hinduja Hospital, he spent nearly a decade at Sri Ramachandra Medical Center in Chennai, where he managed large-scale operations and contributed to building academic programs in healthcare management, reflecting his deep commitment to the professionalization of the healthcare sector. An alumnus of Harvard Business School's Managing Healthcare Delivery Program and IIM Ahmedabad's Executive Education Program, Sir combines global insights with on-ground experience. He currently serves as the chairman of healthcare initiatives at the CII and as the zonal coordinator for West CAHO. He also serves on advisory and academic boards of leading institutions including IIM Kolkata, XLRI Jamshedpur, and IIHMR Jaipur, among many others. A recipient of numerous accolades, including the Patient Experience Professional of the Year 2019, the Healthcare Leadership Award, and recognition among India's inspiring healthcare leaders by the Economic Times. Mr. Chakraborty's leadership reflects a rare blend of strategic foresight and humanistic values. Mr. Chakraborty, we request you to take the stage and please share your thoughts with us.
So good morning, and first of all, my apology for coming a little late here. And Dr. Parulekar, I see him here. He started working, our friend, in my own hospital way back, and other dignitaries on dais, students, and I see Anjanda, whom we looked at during my initial days of career, and always he considered one of the great leaders in healthcare industry. So very privileged to be here, and dear students and people who have come from outside Goa Institute of Management. So here I am going to play two roles. The first role, I am going to represent CAHO, and then as a part of the industry professional, I am going to talk about the subject, the topic what has been taken over here for discussion for the whole day. Very thoughtfully selected and very, I think, pertinent topic for discussion as of now. So when I start, and I represent here CAHO, and I also have one more colleague, I don't see him here now, probably he has stepped out, Dr. Devanand, both of us are here. So CAHO, I heard, and I must tell you, Dr. Parulekar, you told that healthcare program started in 2013. And exactly around that time I had come and I visited your old campus, and I was part of the first edition of this conclave which took place in the hotel in the city in Panaji. So memories, and at the same time I can tell you many of your students every year they come for their project dissertation in our hospital. Almost at the same time, in Indian healthcare sector, another not-for-profit organization was formed by people who had similar thoughts, and they were working on the similar kind of direction, and that was how do you improve the quality of healthcare in the country. And that time, in 2006, many of you may be aware that first time in this country we got our own national accreditation system called NABH. But what happened when NABH came and people started getting into that accreditation process, we have seen it is a standard accreditation framework, and hospitals were getting into it and trying to develop themselves in that framework. But beyond that, what do you have? So considering that objective and aim in mind, what was formed? The formation of CAHO, Consortium of Accredited Healthcare Organization. So the CAHO basically is working after an organization, an institution, they have reached the level of NABH. How do you improve and promote from there? So the focus remains on patient quality, safety, and at the same time, most importantly, again and again, Dr. Parulekar was mentioning about the ecosystem, stakeholders. So each and every stakeholder, how do you ensure that they are committed and they are getting adequate exposure, adequate knowledge, adequate training in quality. So keeping all this in mind, this CAHO started working, creating different vertical under CAHO itself. So today I can tell you, we have a pillar which is called for healthcare institution, healthcare delivery. So hospitals are part of that. So we have a chairperson for that, and they take care of that particular segment. Then we have diagnostic forums. So that means the people who are in the diagnostic sector, for them specifically, what are the quality agendas and how you can improve that. We have certified quality professionals, and many programs are taking place concurrently the way it is happening today in this campus for CAHO, but across the country. It may be on virtual mode, it may be on physical mode, and I can tell you proudly more than 2 lakhs healthcare professionals have been certified over a period of time still now, and it is going on and on. Now I individually have been introduced as a person, as a governing council member for CAHO, but I head another vertical that is called Center for Quality Promotion. So what we do, we have all the accredited hospitals, we give them a different level of criteria, yardstick to comply with. That includes the number of people who are certified in the certified quality programs, professionals programs, followed by the kind of events organized by them in terms of promoting quality in their region, in their own hospital, and the kind of work they have done, which has been done beyond the accreditation requirement. All these have been done, and under that we call that certified as Center for Quality Promotion Center. And in that, as of now in India, there are around 40 hospitals who have been qualified, and they have been given the status of that. Now I can go on and on because a lot of things are happening at the same time at different parts of the country. But many of you, when you are student here, I can tell you, you have a huge access to these materials. You can take part in these events, in these activities, and we also have a separate forum for the students, for the management institutes, and for the student segment, where they join, they participate, and they take benefit, and they get huge, a kind of exposure from the experts from this field. So Why I've told so much? Because I think it is a very good opportunity for KAHU to join hands with Goa Institute of Management, especially for the healthcare management program, where probably our mission, our vision is almost aligned, and we can work a lot together to take it into the next level. And I'm sure in coming days we'll have all these opportunities, all these dreams, what you can convert into reality. And with this, I'll move on to a short presentation of mine where, Arif kindly told me that please touch upon the theme of the event, and I'm going to do that. But I feel before me, when Dr. Parulekar comes from the pharma sector, like a capsule, he has added everything and he has given that capsule to all of you, and you have got already the glimpse of it. So I'll be very brief, and I'm going to touch upon the theme of this today's event, Envisioning Healthcare 2030, Technological Breakthroughs and Business Innovation. So what is India Vision 2030? And we know that Vikshit Bharat 2047 is something where we are working, and the entire nation is looking forward to see that how that dream can be made true. But before that, we have another milestone, that is India Vision 2030. So we are looking for India into a modern, equitable and sustainable society. Very important part of it, what we need to remember, sustainable society, and focusing on economic growth, social development and environmental sustainability. So probably till 10 years back, we have not heard much about ESG, green, especially in healthcare. But today I can tell you, these are all have become buzzwords, and a lot of people are working on this. And in fact, next week in our own hospital, we have a focus session that how do you bring practices of ESG. Many of the hospitals who are public limited, as a part of their reporting, they need to report the kind of sustainability efforts they have taken. But most of us who are out of this ambit, we don't do that very proactively, but the time has come when you need to work on this. Key dimensions, what are the key dimensions for this India Vision 2030? First is social welfare, and that vision aims to eradicate poverty, and that is, we have several sustainable goals. We have seen Millennium Development Goals and things like that, where all this addresses malnutrition, illiteracy, ensuring universal access to healthcare, and what we spoke about, that you need to bring democracy, and that is something what you need to do in terms of getting this universal, to ensure universal access. But ultimately, a healthy India with a comprehensive wellness system is the top priority. So when we say wellness system, comprehensive wellness system, we mean we have to change our focus from curative care to promotive care. We need to see that how you can bring this wellness component. So the kind of disease burden, the kind of burden you have on the healthcare system, and which is getting again and again stressed because of the kind of requirement, demand, supply gap we have, that is not able to meet the requirement. But our healthcare landscape is transforming, and that is part of it again has been touched upon, rapidly aging population. So today, I can tell you that some of the advanced developed countries like Japan, Netherlands, and all, the way they are burdened with the aging population, we are not far away from there. Very soon, we are going to have a significant population which are going to be part of the age group of 65 years plus, and their requirement and the kind of infrastructure required to manage them is going to be different. And are we geared up? Increasing urbanization, so expectations all are becoming different. And I can tell you, when I was traveling from Panaji to this campus, I was thinking that I have come few thousand miles away from my Mumbai, and then you can see the difference here. The quality of life, the expectation, everything is so different, but the things are quite different there. So increasing of urbanization is happening, but at the same time, whether we are able to meet the requirement and demand what is getting created due to this increase. And technological advancement, the entire day's event is planned around this. Now, what is going to be Healthcare 2030, if we see, it is going to be from care delivery to health empowerment. The citizen needs to be empowered in terms of what they have today. They can take their own decision, they can take their own consideration. So I can tell you something which is not part of healthcare treatment, but today in this country a very challenging and debated topic, that whether I can decide about my own health, can I decide to terminate my own treatment? And in our hospital, around a couple of months back, we have started a living will clinic, and that has been, legalized the first time in the country, where a patient can give a living will when they are alive and active, that what kind of treatment, what kind of intervention they want to take if they are sick and they don't want to continue with the active treatment, the treatment protocol what have been so far suggested to them. So proactive health management, we need to look at it. We need to look at it from patients as active participants. For a long time we have seen that patients, they are just part of the treatment process, but they have not been considered as an equal decision maker during the decision making system. Cross-sector collaboration, and which is very, very important, whether it is health tech, whether it is pharma, insurance, they need to come together and work. Rise of digital first care. So when we talk about equitability, when we talk about easy access, probably this is going to work a lot. Technological breakthroughs transforming healthcare. A lot of discussions about AI, genomics have been done already and going to happen throughout the day. Extended, reality, VR, AR, and when we spoke about AI, then we need to see that how all these components can be integrated together. Data, one of the most important component, and we are discussing about it. And those who are students, I'm not sure whether you heard about this, the new act which has come, DPDP, and after that era, when it gets into effect, the kind of challenges all of us are going to have, because we are we are working with so much of patients' data, we are sharing everywhere. So how do you secure that, and at the same time, how do you make it a meaningful one? Most of the Western countries today, they are working extensively on this data and making some meaningful solution, creating some meaningful solution, and they're looking at India. The reason is India is the gold mine for all this data. But unfortunately, we don't have much effort here internally in this country to see that what best we can gain out of all these available data. Biotech and nanotechs are there, and business innovation in this new health economy is going to be very, very, very critical and crucial. Some are going to be, I have even shared here some of the components who are going to be part of it. I'm not going to get into the details of this, but most importantly, when we have these opportunities ahead of us, we have all these players with us who are going to contribute and really be going to be part of this. We need to see how we can create the healthy ecosystem to get garnered this kind of all these members' strength and get the best possible result. So, and innovation in the future, a call to action, and already it has been told that I heard and I liked that very much around a decade back when I was spending some time with Cleveland Clinic. They have gone far, far, far ahead, and they started working on patient experience, what was not known in this country. And when I got exposed to that environment, they created something called empathy story. And what are those empathy stories? Empathy stories were from their ex-patients or people who have worked with some critical patients and they have saved, or many cases they may not have saved, but how a small action of empathy has made a difference in patients' life. That has been shared with them. The reason was they wanted to create the culture of empathy across the organization. So why I'm mentioning this, because AI alone cannot create that, and probably this kind of humanity, this kind of empathy needs to be integrated, and that is going to be the future. So we have to be responsible, we have to be accountable, but at the same time we have to see how do we remain in the forefront, that we are prepared for to handle the future and the next decade or next century. When it has been mentioned the 20th century was the most challenging growth and all we have seen, we don't know what is happening in the coming century. Probably all of us will not be there, but we have to create the platform which can help the future generation to work in a solid foundation to deliver things which are going to be really good for our patients. So why this empathy and AI I harped on? Because as a story I can tell you, the Cleveland or most of the US hospitals were not very keen, or they didn't start in their own this kind of journey. They are forced to do because of their reimbursement system and reimbursement mechanism. So they have a system where a third party take the patient feedback after discharge and they decide what kind of quality care each hospital is giving, and on the basis of that, insurance company, they decide the reimbursement model. And that made them and they are incurring huge losses time to time because of poor negotiation with the insurance company or their ability to get maximum reimbursement. And in that circumstances, they realized that they need to bring this patient experience, empathy, and that model, and they became the pioneer. And as a result of that, not only in US today, most of the advanced or developed countries, hospitals have got into this and they are trying to inculcate this culture to ensure a better healthcare environment delivery model, and I think we need to do with that. So I'll end with this, that 2030 is not the future, it is the frontier we must design today. Probably it has started happening here today, and I wish all the very best, and I wish all the success for this conference. Thank you very much.
Thank you, Mr. Chakraborty, for that comprehensive perspective on healthcare innovation and today's realities. Our next speaker brings a crucial dimension on today's conversation, India's AI strategy and the relevance of it to healthcare. Mr. Swadeep Singh serves as the General Manager of Data Science for the India AI Mission, an initiative that is positioning India at the forefront of artificial intelligence development and deployment, where he leads the AI Kosh pillar. With over 14 years of experience in AI, data science, and analytics, Sir has built and led scalable data practices for Fortune 5 companies with a particular focus on healthcare applications and digital transformation. Recognized among India's 40 under 40 data scientists, Mr. Singh holds multiple US patents and research publications that reflect his deep expertise in applied AI and advanced analytics. His professional journey blends technical excellence with strategic leadership, contributing to the growth of India's AI ecosystem. An alumnus of IIM Bangalore, NIT Patna, and London Business School, Mr. Singh continues to champion responsible AI adoption and the use of data science for social and economic impact. His work encompasses not just technological capability, but the ethical frameworks, governance structures, and democratization strategies that will determine how AI transforms Indian healthcare. Mr. Singh, we are eager to hear your vision for AI-enabled healthcare transformation in India. Over to you, sir.
Thank you everyone for inviting me here. I represent India AI, and it's a mission which is very close to our Honorable Prime Minister, because at the end of the day, we want to position India as forefront of AI, not just doing AI for India, but leading it for the entire global south. But when we start talking about AI, there are three important components which we consider are important. One is the domain, where actually the problem needs to be solved, where AI would come and transform the world. Second is the AI and the technological advancement itself, which itself is transforming, and with all the advancement in terms of technology, compute access, the cost in terms of data acquisition which coming forefront, which is making all the things possible. And the third important component is to democratize and scale AI as well, where people and colleagues which are present in the room will be taking it forward from the small pilots to the large scale innovations to the large scale transformations which we are going to experience. That's what the India AI mission is all about. And when I start seeing Goa Institute of Management, I start seeing a mini version of the same existing over here. There is a very good healthcare focus out here, which is brings a lot of domain expertise in terms of the problems or how the system needs to be run. There is Center for Big Data, Analytics and AI which gets developed over here, which brings all the technological components coming together. Then the third component is through these sessions where they bring the external participations, the local community leaders to actually scale up and make things possible on the real world ground rather than just keeping it within the lab factory. So it's a very good small version of the vision which we are having, bringing the domains, bringing the AI, and bringing the democratization of the all three combination together. So I had a very fantastic experience, and when we start talking about this more, I will be talking of these three elements only, where we will discuss about healthcare, we will discuss about AI, and the democratization part of it. Healthcare itself is a very vast subject, and it's very dear to me. I've spent around 12 years working in healthcare AI as a domain, and the thing which differentiates healthcare for me is the purpose itself is very different. The purpose of life is health. You are not working for just for financial statements. You are working for quality of life. You are working for quality of healthcare. You are working for longevity in life. You are working for disability-free life here. So the factors on which you are working is very different. You don't have to just measure a P&L and you say, okay, I have done a good job. It's very different. The challenges and the opportunities are very different as well. The data which emerges out of a healthcare is huge in terms of x-rays, images, sensory data, human behavior. There are lots of data, something which could be detected, and things like mental health which still cannot be detected. So the data landscape and the challenge which it holds is pretty interesting as well. And that's where companies, technology companies like Apple, Google, they're investing a lot on healthcare, and they're investing a lot on healthcare professionals as well to come and build AI for health. So when we talk about health in India, it is not just about things which are happening in AI, but there are a lot of technological advancements which are also happening, which are bringing a lot of significant changes and lots of benefits which has to be visible. During COVID times, we became one of the biggest adopters of e-health services. E-Sanjeevani has crossed over 309 million consultations. There are a lot of AI startups which have emerged. Our average life expectancy is increasing every time. The death rates have reduced, and there are a lot of workforce which are there both in traditional medicine and the new age medicine. The AI holds a core part of how this entire ecosystem, which is backed by the digital health, could be elevated to the next level in terms of accessibility, in terms of quality and cost. AI holds a very strong power. Just imagine there is a person in a villager. They sometimes rely on compounder acting as a doctor. They end up taking medicines from them. Their diagnosis is so much delayed that they only reach hospital after their situations are aggravated. Sometimes the cancer is detected at stage 4. You don't have a public health system to screen patients for, say, as simple things like TB, diabetes, retinopathy, where if the patient arrives late, the cost increases, the sufferance also increases. In terms of quality, doctors right now have to work with tremendous amount of data, lot of IoTs, lot of patient histories, and there's a lot of loads as well. They are also under pressure to create quality life. Like sir was mentioning, in Hinduja they have said, okay, there's a label where what are the treatment which needs to be taken. They can also decide and then say, okay, well, what is the personalization which I need to have? The precision medicine is talked about. There's a first step which sir mentioned. They have started taking in that direction. Maybe not through a technology, but through an intervention which they have started in their hospital. Doctors are under pressure, and that's where the quality becomes even more important. How do you reduce readmission? How do you increase the healthcare experience? How do you increase best doctors are able to treat as many patients as possible? Even the patients who have accessibility issues, they get the best treatment. And then at the end of the day, cost definitely plays a very important role, because whatever you are doing, the supply chain, whether the insurance system where healthcare financing is coming in, you need to optimize on the cost, because healthcare costs are rising. You cannot sustain this indefinitely. That's where the AI opportunity comes in. And there are real problems which are there. Shortage of radiologists. You cannot have radiologists coming everywhere. Rural health access is a problem. Delayed detection is a problem. Communicable disease is a problem. And for us, AI could solve some of those problems. May not be alone, maybe with the technology, but it can solve some of this problem. For patient, preventing disease, coming as a one-stop shop for a lot of solutions may come up. For physician, one of the major problems which I hear is the keyboard liberation. They are meant to treat patients, but they sometimes have to work on computers. Hey, enter data on the EMR system. We need to collect some data. We need to give some justifications to the patients as well. After they have given the treatment as well, the entire cycle of payment, insurance, they all require lots of paperwork and lots of administrative processes. So keyword liberalization is what they seek for, the medical insights, so that they are able to personalize the treatment is very important as well. Say a person who is undergoing transplant surgery, doctors, if he gets information of the donor and the recipient with all the relevant details, relevant insights on what the longevity of a particular transplant may be. That's give him more confidence, and it also helps him plan his surgeries better. And also to the caregiver, who is always beneath the patients, to serve them better, to ensure a medical adherence or a prescription adherence is achieved at the utmost level. So there are a lot of outcomes which could be have. With this, there is a technology which needs to support, and in technology, there are certain challenges and there are certain challenges and there are certain solutions which are coming up. Some people have already started a journey. These are some examples. Cure AI, who is doing a lot of TB detection using the machines with the technician without the help of radiologist. There are screenings which are happening for diabetes retinopathy. There are breast cancer screening happening. So a lot of diagnostics treatment happening. At the part of quality for treatment, there are teleconsultations happening. In telehealth is what India is supporting to build one of the India-specific LLMs model for health. There's Eka Care, who is taking care of a lot of administrative burden, reducing costs through EMRs and EMR-generated insights. But right now, these are all at nascent stages. The AI has just started. It needs to scale up. And that's where, to further fuel the innovation, we will need to address some challenges. There is challenge in compute, where these technologies sometimes are expensive. Maybe the technological intervention will need to be, the cost of the technological intervention needs to be reduced, or the accessibility to the compute needs to be managed at a better pricing. Data. There is a good part and the bad part. The good part is we are generating a lot of data, and data is getting generated with a cost-effective manner. We were talking about genomics. If we go about just 1995 or something, each genomic sequence used to cost around $1 million. Now, within some hundred of dollars, say $200, $500, you can get a genomic sequence. Similarly, with a lot of sensors coming up, with sometimes non-piercing everything, a lot of data is getting generated. But the second part to take the technology forward is to make the data accessible and accessible to the innovators as well. With the DPDP coming in, how do we ensure or make sure these accessibility for AI trainings are ensured, protecting both the privacy part of it, but also ensuring a system where the innovation could continue in terms of data and analytics built on that. The models need to come up together as well to build this solution. And the talent which are sitting over here may need to come together, think of the innovative methods, not just work on the traditional systems, think of designing the future. India AI as an ecosystem has started doing some of those things in order to build a technological framework to support the entire AI democratization, from the foundational stuff where we have developed AI Kosh as one of the repository for anything which an AI developer may need. It's our database repository where lots of open source data are being exposed. We are unlocking public data because we cannot just say, okay, private people start contributing data. First, we are trying to unlock data from the government side so that people need to have the data access which is required to build the models, build the solutions over top of it. Again, envisioned as one of the future of a DPI for AI ecosystem where everything from toolkits to ethical frameworks will all be hosted within AI Kosh, which will advance the innovation as a one-stop solution. Compute, which we are providing as a method to give access to a lot of resources for performing these technological interventions. We are supporting a lot of innovations through development of foundation model. 12 partners have been selected and one partner specifically is focused on creating health-specific LLM. It's important for us to depend on our own sovereign models rather than depending on external models because the data on which they were trained may not be representative. And as we are going forward in terms of cost and accessibility, in case they are sovereign models which gets developed, we have a greater access to our system. There are a lot of tools which are creating safe and trusted methods as well, so that ethical tools could be sustained and create and maintained over a long time. We are supporting a lot of things with future skills as well, where there are a lot of programs being launched to support students as well. Student community over here may go to India websites, maybe they can apply for those internships or maybe apply for those fellowships where if there is a PhD programs or if there's something they want to do with AI, they can apply for those schemes as well because we want to incentivize those innovations. And innovation doesn't look at just a level of say BTech or MBA or PhD. We are even going at a ground root level. We are creating a lot of data labs because data readiness in terms of annotations is also important to get AI ecosystem moving. So creating a ground force as well ready for AI is what we are doing. Through startup financing, we are creating fund of fund to support a lot of niche AI startups so that we can make them scale up. At the end of this, when all this will come together, it's the application which actually any person or any user will be touching base. Is this application where the solution will be getting realized? So there are a lot of solutions within the health space as well, which we have mobilized, whether it is in TB detection, whether it is through a smart solution of managing autism or maybe creating a disability-free environment as well. So we are supporting that in order to work and scale those environments as well. Again, just double downing, one of the important components will be the data, and that's what we are democratizing. Over 3,000 data, like this is slightly dated slide, over 3,000 data, 240 plus models are there, and a lot of data are specific to health. In case people are interested to build models, there is specific data from ICMR, which we have unlocked with lesions, clinical scans, surgical data which are there, which could be used for innovations or at least getting started with development of AI models as well. There are a lot of solutions which we are supporting as well, from joint and muscular recovery analysis where you just stand in front of a monitor or in front of mobile, they ask you to act some way and it will diagnose, okay, what is the musculoskeletal problem which you may have. There are solutions which are supporting doctors in taking a decision while they are trying to treat cancers, so that it actually supports while treating a cancer or removal of tumors. An adequate action is taken so that there is no harm on other physical activities, or the post-surgery disorders are avoided. There are solutions in terms of diabetes retinopathy detection and other detections through your retina scan as well. We are enabling disability diagnosis through some of the gaming solutions like Jivisha, Screenplay, which helps in treating and engaging with patients as well. There are solutions which work for tuberculosis and other detections from your X-ray. And again, reducing time from 2 days of getting the final diagnostic reports to just an hour or less than that to get the results as well. We are working on one of the greatest cancer programs with Tata Memorial and NCG to ensure a best cancer solutions are developed in the AI workspace. We already have launched the campaign. There are already 300 plus participants who had applied, and we are just in process of shortlisting. And here, there's a big grant, but then if we talk about the activities, we're going from the ground root level where they would be working with hospitals, from collecting the data to developing the model to deploying the solutions to doing those research. So end-to-end channel, because we don't want to rely on data which may not be representative. Work from the data curation, to understanding and bringing the domain expertise, to creating a solution and deploying the solution. So end-to-end things which we are trying to work out through this challenge. The third part which I was discussing, we had talked about healthcare, we talked about technology, but then it is democratize the same and take it and scale it to the next level. Because we can keep on doing something as a silo, but the real impact which India can make is with the scale which we have, the scale of problem which we can solve. And that's where we are taking a center stage on AI discourse, and we will be hosting AI Impact Summit. This is the fourth event which we launched in series of Impact Summit, AI Summit, which will be hosted in India this time. There were first which were hosted in Bletchley Park, then Seoul, then last year Paris, wherever Honorable Prime Minister said the next event will be hosted by India. And this February, from 16th to 20th, we will be hosting this Impact Summit within India at Bharat Mandapam Pragati Maidan. Again, it will be a gala showcase with a lot of heads of governments, prime ministers, presidents from various countries, top CXOs, top researchers, which will be all culminating with an expo of startups, innovations across dimensions, across sectors like health, agriculture, education, across AI showcase which we want to bring together. The big momentum build which we want to do, so that we just don't keep on talking about AI at silos. We want to actually build the momentum to scale and democratize the AI. This summit will be in series of the global summits which has happened and will be inaugurated by our Prime Minister. There is a lot of pre-events which we are doing. This event is also part of the pre-summit event, and I would like to formally invite you all to be part of that, because that's the place where you will all start seeing a showcase of a gala event of AI getting in and showing to the world how India is getting ready with the AI. We started a bit slow as compared to the external world, but right now we are in a space where a lot of momentum is built in. There are almost like 70, 80 these pre-summit events which have happened. We are trying to host around 50 plus countries, 10, 20 HOGs, and a lot of CXOs from all the industries. We will showcase a lot of great startups in AI coming up and showcasing the entire event. There are a lot of flagship events which are there, which students could participate as well, from research symposium to AI for All Global Challenge, to the expos, to the Pitch Fest, to the AI by Her, to the UIAI. UIAI, which may be relevant to the student community who are less than 21 years, may be a global challenge for AI startups, and for women-only startups or women-only people, they can apply for AI by Her. And then there would be AI Expo. Some of the flagship, along with lots of talks, research, shows which will be happening as part of event. So there is a big momentum which we are trying to build down. Healthcare is one of the key segments, and it's among the center stage of AI in health. It's among center stage of how AI could transform the healthcare sector. So we are working where domain we are activating technology, and we are trying to democratize it and trying to scale it through the event. That's where your support may be crucial in order to participate and partner for the summits and pre-summit. Thank you.
Thank you, Mr. Singh, for those thought-provoking insights on AI's transformative potential in healthcare and a glimpse of the Impact Summit in 2026. As a token of appreciation, I would request Professor Shirupa to kindly felicitate our distinguished plenary speakers. May I first invite Mr. Joy Chakraborty to kindly come forward for the felicitation. I now invite Mr. Swadeep Singh to kindly come forward for his felicitation. I would like to reiterate our keynote speaker, Dr. Devi Shetty, will be addressing us at 3:45 p.m. immediately after the second panel. I would request all dignitaries to please remain on stage so that we can have a group photograph to commemorate this moment. Thank you all. We will now pause for a brief tea break. The tea counter. Okay, thank you. We will now pause for a brief tea break. The tea counter is stationed just outside the auditorium. Volunteers are requested to guide the guests accordingly. Delegates are requested to go ahead from the wing towards my left. I request everyone to kindly reassemble in the auditorium by 11:50 a.m. sharp for our first panel discussion. Thank you.
Welcome back, everyone. I trust the refreshments has energized you for what lies ahead. We now arrive at the heart of today's conclave, a panel discussion where theory meets practice and vision encounters reality. May I request our first panel addresses a transformation that is already underway, care revolution, how AI and advanced technologies are redefining patient treatment. May I request the esteemed speakers and the moderator of the panel to please join us on stage. Dr. Atantra Das Gupta, Southwest Asia Head and Senior Director of Healthcare Medical Equipment Wing at Samsung. Mr. K.V. Rambabu, Founder and Managing Director of Pulse Pharma. Mr. Joy Chakrabarti, Chief Operating Officer of Hinduja Hospital. And we also have Dr. Sujoy Kar, who due to health reasons is not present with us physically. But he'll be sending his thoughts virtually. And Mr. Anjan Bose, Founding Secretary Journal, Nat Health, and an advisor of GIM. Allow me to introduce these speakers to the panel. Our first panelist, Dr. Atantra Das Gupta, Business Head and Senior Director for India and SARC at Samsung Health and Medical Equipment. A healthcare industry leader with over 20 years of experience, Dr. Gupta has built a career around the philosophy of empowering people to grow business with the objective of creating leaders. He plays a key role in shaping India's healthcare ecosystem as co-chair of the Medical Device Committee at PhD CCI and advisor to both BIS and DPIIT. Holding a master's in biomedical engineering and an MBA from MDI Gurgaon, he continues to study AI, machine learning and digital health through top institutions including IISc Bangalore and the University of Texas at Austin. Dr. Gupta stands at the forefront of blending technology, leadership, and innovation to advance healthcare in India. Our next panelist is Mr. K.V. Rambabu, Managing Director of Pulse Pharmaceuticals and Chairman of the Indian Drug Manufacturers Association, Telangana chapter. With over 4 decades of experience in the pharmaceutical sector, he founded Pulse in 1997 with a clear mission to solve the unsolved and reach the unreached. Under his visionary leadership, Pulse has grown into a technology-driven enterprise and is known for its strong R&D, manufacturing excellence, and patient-centric innovations. As chairman of IDMA Telangana, Mr. Rambabu continues to advocate for regulatory quality, ethical practice, and industry-academia collaboration. He's widely respected for his integrity and forward-looking approach that continues to strengthen India's position in global healthcare and life sciences. We've already had the privilege of being introduced to Mr. Joy Chakrabarti, Chief Operating Officer at PD Hinduja Hospital and Medical Research Center, Mumbai. With over 21 years of experience, he is known for his operational expertise and commitment to the patient-centered excellence. An alumnus of Harvard Business School and IIM Ahmedabad, he serves on multiple advisory boards and has been recognized among India's inspiring healthcare leaders by the Economic Times. He also supports community initiatives as an honorary trustee of the NGO Spare a Moment. Coming to our next panelist, Dr. Sujoy Kar, Chief Medical Information Officer and Vice President at Apollo Hospitals. A clinician, academic, and digital health innovator, Dr. Kar brings over 2 decades of experience at the intersection of medicine and technology. An alumnus of the MIT Sloan School of Management, he leads the Center for Digital Health and Precision Medicine in collaboration with the University of Leicester and serves as Regional Head India for MIT J Clinic. He's a certified Six Sigma Master Black Belt and teaches at IIM Calcutta and the University of Leicester. His current work focuses on clinical AI, data-driven cost optimization, and design thinking in healthcare, redefining how technology enhances care delivery and patient outcomes. Due to health reason, Mr. Kerr is unable to be with us in present today. However, he was kind enough to share his thoughts, which we'll be playing later in the session. To guide this discussion, I'm pleased to introduce our moderator of the panel, Mr. Anjan Bose, a distinguished healthcare industry veteran with decades of leadership across global organizations. He was the founding Secretary General of NAT Health, the Healthcare Federation of India, and has held top executive roles, including President of Philips Healthcare and Consumer Lifestyle for India and South Asia, and Asia Pacific Vice President for Emerging Markets at Hewlett Packard's Medical Products Group. He has also served as Managing Director of Datex Omeda India and chaired several industry bodies such as CII's Medical Equipment Division and FICCI's Healthcare Services Committee. Currently, he mentors and advises leading organizations including FICCI Healthcare, Tata Medical and Diagnostics, India Accelerator, and Goa Institute of Management. A respected thought leader and moderator, Mr. Bose continues to champion innovation, policy, and collaboration in India's healthcare ecosystem. We are honored to have all of you join us today, and we look forward to an enriching panel. I request Mr. Bose to lead the conversation. Thank you.
Okay. All awake? I'm asking because most of you, the audience now are students, very beloved students. I've met quite a few of you. Am I audible? I was given this box, Jazzy's that thing doesn't work with me. I'm too fidgety. So it is better for me to use what the panelists are. Two changes I made. This is the first change. The AI is for change, so I made two changes. One is this one, and the microphone, and the other is shifting from here to here. Okay. Closer? Okay. Closer to my mouth? Okay. Is it audible now? Okay. So, in the morning, thanks to our eminent speakers, we learned a lot already. So, I think we have got a fair basis of what the conversation will be. The core message of this panel is care, revolution. There's a difference between revolution and evolution. Evolution is slow, anticipated, forecasted, predicted. Revolution, you don't know what's going to happen. That's why this nice name has been given by Professor Raza and the team, the conveners, and I think it represents what artificial intelligence is beginning to do to many sectors, including healthcare now. So, just to recap, you heard a lot of areas that artificial intelligence in healthcare can do, but to recap, I want a show of hands. How many of you are present in the last conclave in September 2024? Anyone was there? Only a few? Okay. Okay, then I think it's worth starting from this point. Last year also we had, in a little different way, artificial intelligence, right? And we discussed this is for the panelists, to see how we are progressing. Sometimes we keep discussing a lot of new things and don't take a count of what we discussed a year back or so. I remember Joy is a dear industry friend. We often raise this point that we should have an assessment of how much progress has happened or have not happened. So I thought I'll start by mentioning this. Last year, it was very exciting and meaningful discussions on AI, and it was not as advanced as it is now. That was 14 months back. And in 14 months, a lot of water has flown below the bridge of AI, right? We discussed medical imaging analysis. We had colleagues from imaging. We have got Dr. Atantra Dasgupta. With all of your permission, since I'm the youngest here, I will take the liberty of calling you by first name. That makes it easier. So medical imaging analysis, and I'm certainly looking forward to hear from you, Atantra, about the CT MR jugglery that you are talking about when your turn comes, okay? And we discussed predictive analysis, obviously, and we said AI predicts patient outcomes, AI predicts high-risk diseases, onset of cancer, for example, and how cool is that? Because if that happens, the chance of recovery is much faster. The basic mantra in healthcare is faster diagnosis, accurate and faster diagnosis. We discussed personalized medicine. We heard about it from some of the speakers. From standardized protocols, healthcare is going in the direction of predictive analysis, predictive treatment, and personalized medicine. It's important, but I think personally there is a lot more excitement at this moment than what the real world is getting. But it's a right direction. We discussed things like mundane but important things like chatbots, virtual assistants, how they work, clinical decision-making supports, robot-assisted surgery, obviously robotics, which has grown phenomenally in the last 1 year, natural language processing, all this LMM, large language, which you hear about AI, disease detection and prevention, it was talked about, mental health support, we didn't discuss much, but it's a very interesting area. I think director mentioned mental health in his address. That's a very interesting area where AI can contribute. And we discussed the very boring sounding but very important streamlining a whole lot of administrative tasks. Often this area, how much AI can contribute to increase the efficiency of even clinicians, I think Mr. Chakraborty Joy will be able to tell us that AI, as we go forward, how much Hinduja will benefit in terms of saving wastage of specialist hours, if I may say. You are heading the operations of India's one of the most eminent and largest hospital group, and I think efficiency and productivity has been always your hallmark, and it would be interesting to know from you. So I'm just giving some broad background of the areas, and I like to have this more, as I always do, as a conversation rather than question-answer session. These are all very senior leaders. You know, once Sir Winston Churchill said that I am always ready to learn, but I have difficulty in being taught. Many of you students feel the same way sometimes. I have felt it in my IIT days. I'm ready to learn, but I have difficulty in being taught. But I am very eager to be taught by these super experts who have their own domain experience for many decades. And now at the confluence of AI, bringing in disruptions in their lives, in what they do, not personal lives, but in what they are doing in daily lives. So I will start with, we have got, you just heard that one of the 4 designated panelists, because of health reason, Dr. Sujay Kaur couldn't join this personally. We have a video from him, about 7-8 minutes, which will be playing in the end. He has nicely summarized. So now I have a lot more time to ask and get enlightened by my 3 colleagues here. I'll start with Joy, you. Again, please feel free to go beyond the realm of this question, whatever is relevant. But I'm starting with this question: how are AI-driven technologies changing the way? Very mundane sounding important question, I think. Healthcare providers, how are they going to change the way healthcare providers approach patient care, and what are some real life, real world examples of improved outcomes?
Thank you, Anjanda, and I was waiting very anxiously for the tough question to come from you, and I know you for last more than 20 years, and I have seen how you give googlies. So, but it is very, a lively thing from my practical experience, and I'll talk about some of the things what we have done in Hinduja. Maybe some are going to be in the pipeline too. So I'm going to share with most of you are students here, so it will be a great thing for you to hear it and see whenever you go to a hospital that whether that is happening. So what we have done in Hinduja Hospital, we have done completely something called patient journey mapping. So before even a patient, gets into the hospital, they look and they search for information, until after discharge also they look for certain supports from the hospital. So at each of this level, what kind of things we have done, and especially for the application of AI, I'm going to touch upon. So when a patient, they look for, and in most of the cases it is a business challenge for a hospital, that how do you attract new patient, how do you retain new patient, and how do you go with them, because the market is going to be very competitive, and especially if you look at Mumbai market from where I come, in that Mumbai metropolitan area, we were very comfortable to have certain number of hospitals, but now the number of beds have been added close to 1,000, and it has been predicted that in next 4 to 5 years, there are going to be 9,000 plus more private sector tertiary care beds are going to be added. So you can understand the kind of competition is going on. Now I'll tell you, these solutions are giving very efficient and at the same time helping you to remain at the forefront. This year we are going to complete our 75th year. So we have a strong legacy, and at the same time we need to remain in the forefront. So what are you doing for that? So like many industries, what we have, AI-enabled chatbot. When patients are looking for information, quick information, at the same time appointment, they want to get information so quickly, because the generation, maybe my generation or after my generation, they are very impatient. They want to see things how it is going on fast. So they don't want to call a call center, they don't want to get a call back, they don't want to drop a mail. So they want immediate information through like a chatbot. So we have done that enabled chatbot. We have geofencing in the hospital where a patient is coming, and there they can we can see who is coming, who is going to be confirmed patient in the OPD for that day, so we can do your operational planning. The third thing, what you're almost at the at the stage of implementation for the hospital, that is what many of you have experienced in the airports, that is DG Jatra. So we are going to have in the hospital where a person, they just enter like a DG Jatra, they just check in, they need not to go to a counter, and that can help a clinic to know how many patients are there in the queue and what kind of load is going to happen that day. That also help us to plan if anybody who is waiting for an appointment, how do you get them if some dropouts are there. So there are many of these. I can go on and on. 2-3 more I am going to touch upon. If a patient is in a doctor's room, how do you effectively manage the doctor's clinician's time, and how do you get the best return out of that valuable time? So patients, they tell a lot of things, doctors, they need to write down, but on an average it has been seen, and report has been published by Times of India a few years back, that on an average in India, the average doctor interaction with the patient is 2.5 minutes. And Anjanda will remember, in a similar line, there was a report published in the FICCI conference in the presence of the Minister of Health, where a lot of things came up, patient feedback, and they gave not a very good feedback about the tertiary care hospital healthcare delivery system at that point of time. So when you say 2.5 minutes is the average, you can understand what is happening in a so-called public setup and versus private setup. So to make it more useful, few years back we got something called DocSpur, which is now the company is called as Inform DS. So what they did, they gave a pen which writes on a paper. So doctors, they don't feel that their practice needs to be changed. They were writing, and it is transcribing things in the system. Everything get digitized, so your records are there. But how it helps us? It helps us in terms of you pick up from there how many ultrasound prescribed, how many CT scans, so you know whom you need to tap to get those things fixed, so your business doesn't get affected. But we have gone one step forward. Right now there is another technology which is like a speech to text, and the technology, the company, the product is known as Suno AI. I'm not sure how many of you have done. That is SUNOH, Suno.ai. That Suno AI is a fantastic AI solution where in the doctor's room, when the conversation is going on between the patient and doctor, in your predefined prescription format, history format, the entire conversation gets transcribed into multiple language, and it is depending upon your option what language you want to look for, it gets. So even if a patient tells at the fag end that 2 years back I had a surgery, it will not come at the end, it will automatically come in the history of the patient. So in that way, when it is completely done, it is saving doctor's time they need not to write, and most painful thing, I'm not sure how many doctors are there, when doctors write their handwriting, patients they never can decode. So in this case it is getting into WhatsApp mode and going to the patient. Then couple of more examples I'll give before I end. For the inpatient, this solution we are one of the first one to get in the hospital, called Dozy. So many of you may be knowing about it, that Dozy is capturing live the patient vitals, and that vitals, from that vitals, not in critical care areas. So if a patient's vitals are going somewhere haywire and nurses have not noticed, it will give a trigger, and if they need immediate intervention, that can stop patient shift to the ICU. And that will save the hospital resource, patient's resource, and their whatever critical condition they come across. So in that way, every month we see the effectiveness of that, and we see how many lives we are able to save. That record is printed. And final thing I'll give you, we got something called, for the discharge summary. One of the operational pain point area is the patient discharge. In the hospital, it takes few hours. Everybody creeps about it. So we got a solution which is again voice to text, which gets transcribed, and the solution called Ognito. So in that Ognito solution, earlier when I had 6 medical transcriptionists who used to type the recorded message from the doctor for discharge summary, instead of that, doctor started dictating, and at the back end through the AI, that converted into the proper discharge summary in the format. And I can tell you, in 2 months' time, when he implemented in the whole hospital, 2.5 years back, I got 6 of my medical transcriptionists reassigned in the other area who could do some other work, and at the same time it was giving very accurate discharge summary very quickly, and most importantly, it was doctor who was accountable for the correctness. Earlier there used to be a blame game. I told this, they typed something else, and as a result of that this has gone something wrong. It has medical dictionary related AI enabled at the back end, so it can catch. It will not work for any other sector. It works only for the healthcare. So some of this what we have done, which has brought lot of efficiency, productivity, and at the same time patient satisfaction.
Excellent, Joy. That was, I think, for all of you, it is revealing. We are talking really real world, good benefits from high technology focused on AI. Excellent examples. I think we can all relate to that. And I think you played my googly very well. And, in the sense that in a few minutes you have addressed how India is one of the most successful and eminent yet traditional hospitals addresses this key question that I mentioned, that why are we wasting expertise in time-wasting administrative matters, and so on and so forth. So Joy, thank you very much for giving real-life examples, and I'll go to Atantra now, Mr. Atantra Dasgupta. Atantra, googly for you will be, the good and bad and ugly of any technology, the famous movie of Clint Eastwood.
Mm-hmm.
So what do you think, if you extrapolate the past, this is envisioning 2030, and you have been in technology for for decades now. Where do you think AI-based and other high technology initiatives will carry patient care to around 2030? What will be the standard protocols at that time? How will they shift? Like Joy mentioned a few things. These are best practices which others will catch up, and other hospitals, when they start adapting, these will become perhaps standard protocols. Because of what he rightly mentioned, there will be competitiveness in any urban area or rural area. That is one part. The other part, the next ball, is how do you combine all these with the necessary regulatory requirements? Because anything needs to be regulated, whether we from the industry, once upon a time, I also have complained at times, what is the right balance between regulating for patient safety and patient quality? That's the ultimate, right? As the director mentioned, healthcare with a humane approach. Patient is the hero, the real hero. Everything has to be patient focused. Technology is also a support system. So on the one hand, envisioning 2030, what will be the technologies, where will all these carry the standard protocols to, and how will we balance the needs for cyber security and other regulatory measures? All yours.
Thank you. So I always consider you as my boss, today also. So
Thank you.
The question is
Similar.
similar.
Was in Philip's team, a brilliant person at that time.
So, so we need to understand one thing today when we talk about AI. AI is all about data. And now we have to think through that the data is within the four walls of a data center of a laboratory, or it is with the masses, with the population. That's where the answer to this question lies. What regulations can do, what protocols can do, because each one of us is the resource of the data, each one of us. So the first question arises, whether we are going to be exploited or utilized. So that's where the policy decision will be. So today, when we talk about big hospitals, big diagnostic centers, they claim that they are owners of the data, but they are not the owners of the data. They are the repositories. The owners of the data is you and I. That first, that needs to be recognized, needs to be respected. Any model which is going to get formulated or invented, the resource is us. So that's where the entire question, the entire protocols, the entire standardization lies. Now, the quality of AI models depends upon the quality of data. That is very, very important. And what is data? We need to understand what is data. Data is the digital manifestation of our physical body. It comes from within. The algorithm comes from within. So we need to understand that when we are talking about masses and about the population, there has to be a democratization. Today, really, the regulation helps. Just few days back, we got a very sad news. A lot of children died in Chhattisgarh and MP, Madhya Pradesh, of a default of a mistaken formulations or something bad has happened. But regulation is there. There are all types of security measures. There are regulatory bodies. There are CDSEO, there are state CDSEO, but then, so we need to be the citizen scientist, each one of you, each one of us, because we are the resource today. No medtech company, no IT company, no hospitals, no diagnostic centers. It is us and about you and us. It is we. We constitute the resource, the producer of the resource. Today, a lot of things are happening everywhere. We have to be very, very vigilant about it, because we are responsible for the quality data production and protection, both. So when the data is originated from us, we need to be very much conversant and ask that where this data is going to be utilized. I hope I am clear to everyone. So this is my answer to your googly or the wrong one. I will tell it is a wrong one, not a googly, more difficult. So I prefer to answer with all of us being as stakeholders to it.
Yeah, I'll just like to make a quick comment on what Atanto just said. You know, ownership of the data remains with us, with the citizens. So, you know, from all this conversation, if especially our student friends are picking up top 10 themes to ponder over, to integrate into your thinking process, and as you go into the industry, you question yourself that what is my role going to be? You are all future leaders, right? And as leaders, every day you will be immersed in situations like this from your organization point of view also. So it's a very, very good point. There is no clear answer to that, except that we have to be vigilant, and we have to be, we have to be aware. And I think there will be need for a lot of, if I may use a mundane word called training, a lot of understanding, awareness generation, etc. So this part is okay. I'm just with a pause, Ramavu, I'm going to come back to you after Atantra answers my 2030, his response of, technology, standard protocols, etc. Pharmacovigilance, and he has given an example from yours, directly your segment, which happened recently. So I think everybody will be interested, and especially the students here, what are their learnings when they go to the industry as future leaders very soon? What are their responsibilities? It would be wonderful to hear from you after Atantra can respond to the first one, the second one. 2030 standard protocols.
So the standard protocols will depend upon the generation of the quality of the data. We have to know that what are the means from where the data is collected. Because today what is going to happen, it is the mutation. It is not a revolution. Sorry to, I differ with you.
Sure.
I think for the first time. Well, but today we are talking about synthetic intelligence, not only AI. So what this synthetic intelligence is going to do, it is a mutation. It will produce, remanufacture, reproduce everything on its own.
Excellent point. It's an excellent point, actually.
So yesterday,
I'm happy you disagree. We'll come to that.
yeah, because Dever is always against the evolution part or the revolution. So I prefer to use the word mutation here. So now with the synthetic intelligence coming in, where are we heading to? We need to understand. Now generative AI was there. Yes, then there was the hallucinations and all those parts, the guardrails has to be there. Then the agentic AI has come. That's with a very little information, you can get a lot of information. So where there will be the guardrails? How can you induce cyber security? And on top of that, synthetic intelligence is there, which is coming, which is in vogue, rather. It will be there. So that's the 2030 or 20, today is 2020, yeah, just 5 years. Yeah.
Half a decade, yeah.
So that will be there. And then I think everything will change, because change here is a profound word. It's not just a 5-letter, 6-letter word. It is going to change the entire thinking, entire protocols, entire specifications, entire norms, and the regulation.
Excellent. Rambabu, before you take this on,
Yeah.
I just want to share with you, I'm always lucky, before any, historically I've seen, before any panel discussion, this is old habits from the college days, you mark at the last moment, I'm sure all of you do also. In the previous couple of days, there's a lot of relevant newspaper articles which help me with this conversation. So Atantra made my job easier. First of all, I mentioned Sir Winston Churchill, what he said, that I'm always ready to learn, but I don't always like to be taught. And I defied that, and I said that I'm here to learn, and I'm here to be taught. So mutation is an excellent word, I think, I mean, it's like amoebas, regenerating itself. It's a great word. Now, this article in Times of India yesterday, I was reading in the flight, food for thought, vis-a-vis what Mr. Dasgupta said. We don't need separate law for artificial intelligence. Experts panel has said this. And there are a lot of details which we don't have time to discuss, but very relevant detail. But the headline on the face of it can be a shocker. That is this so? I mean, there is no new law compared to all the other technical regulations that exist. So it's a food for thought, and if there is time, you guys can also mention a little bit about it. Off to you, Rambabu, there is healthcare deliverer, there is technologist, there are diagnostician, but pharma, you all know that pharma, India is the pharma, is a pharma capital of the world,
Yeah.
We say pharmacy of the world. And therefore, in all these decades where I have handled healthcare, I have looked at pharma professionals with awe, because that's a different world than Joyce Deliverer or MedTech of Atantro. So please give your 360 perspective on the possibilities driven by AI in the next half a decade, 1 decade, and also do give a thought about this, your thought about this regulatory business vis-a-vis the example that Atantro mentioned.
Yeah,
Yeah?
I'll
So
take
please-
that.
please go
I'll
ahead.
take that
Yeah.
issue a little later. So I think we three seated here, we together deliver a quality healthcare. I think you understand that. If only hospitals cannot deliver a healthcare, they cannot treat the patients without diagnostics and without a pharma product, right? So we three are the major stakeholders and are partners in delivering this, care to the patient. Now, when we are talking about this AI today, AI is a new technology we are talking about. Any technology that has emerged in the world, right from your mechanization, so we were all earlier, doing everything manually. So there was a industrial revolution that has happened because there was a lot of engines and machines were invented. So with that, what happened? The productivity increased. So we have been able to produce more with less effort. So the prices have come down. So the products became available to more and more people. So it became more accessible. So same way when the social media has come, so that also has changed, how, the people, their relations were managed. Earlier, relations were only happening within the family and within the small groups. The social media has revolutionized how we managed our relations, how we engaged ourselves. So that has done some good and that has done some bad also. So now the AI has come. So AI also is here to increase the productivity in every sector, not just in pharma, healthcare, or medtech. Every sector, it is only meant for increasing the productivity, bring down the cost of production, bring down the cost of service, delivery of the service. So eventually the beneficiary is the consumer, whether it is a patient or a consumer. So everything is revolved around making the consumer empowered. So that's the whole idea of all these technologies. But as long as they are used in a responsible manner, if they are used, every technology has got its own pitfalls. So like that, AI also, if it is misused, it can produce bad results. But if it is used, it can produce wonderful results. So when it comes to pharma, in fact, AI has been already in use for pharma for decades. So I don't know how many of you are aware. The drug discovery, AI has already been used actually. In silico modeling has been used for last 2 decades. So a lot of predictive analysis was done, and then that's how you were doing all the screening of molecules, and then you were able to arrive at the probable candidate, and then you do the further experiments. So now with the AI, that process is further accelerated. It is not only used in the drug discovery, it is used in the entire spectrum of drug development. So right from designing the molecule to the formulation development and the clinical development. So the entire spectrum of drug development, the AI is getting used. So therefore, it is expected that the average time that would be taken for commercializing a pharmaceutical product will be drastically reduced, which used to take about almost a 10 years time from a concept to commercialization. So now it is expected to come down, maybe around 4 to 5 years, we should be able to do it. So now I'll talk about briefly. So drug discovery we were already using, and now there are better tools that have come. So one of the example in the COVID time, so baricitinib was a JAK inhibitor, which was an anti-inflammatory drug, and people want to find a quick solution for COVID. So it's anti-inflammatory. Can it be used along with an antiviral? So the AI has assisted in hypothesizing this idea, and then the clinical protocols were developed accordingly, and the clinical development has happened faster pace, and the approval has happened in a record time. So this is one of the example where AI was used. And in clinical trial today, one of the major problem in clinical trial is patient recruitment. Today, the protocols are designed, but we do not get the patients who would exactly fit into that protocol, the exclusion and inclusion criteria. But with the help of AI, the entire data is available, so you will be able to know where these patients are located. But of course, there are some more regulatory changes that have happened. So now that you are supposed to do the clinical trial within the approved center and the approved investigator and all that. But if the regulatory changes can happen, so it can be democratized, so you can recruit the patients from anywhere without limiting to the geographical limitation. You can actually take out, and then the faster recruitment of patients into the clinical trial can happen, and that is how the clinical trials can be completed faster, and that's how the drug development can be hastened. So that's where one of the possibility of the AI application. So now that's one part. Then coming to the quality. So many times pharmaceutical quality, whenever some failure happens, like the incident what has been cited about this cough syrup incident, so the regulators and the quality professionals take lot of time and lot of effort in investigating and finding out the root cause for that quality failure. So many times they will not be able to even find out the exact root cause. If the entire data is digitalized, and AI can just find it within no time. So, but the only prerequisite here is digitalization of the data. So AI cannot do any great thing without digitalizing the data. Digitalization is a mandatory requirement. Now that is where the pharma industry is moving. So from a manual record keeping to the digitalizing the data of right from your procurement of materials to how they are tested, how they are dispensed, how they are processed, all the data getting digitalized. So therefore, it will be easy for you to find out the reasons. And it is not only the data is not only just generated by the humans, or not entered by the humans, but the data is generated by machines also now. So you need a lot of sensors and a lot of machine learning is required. So everything has to be automated. So only then AI can give you the real benefits. So that is what some of the pharma companies are now focusing on, digitalizing their processes, manufacturing processes. That is how they can immediately find out where is the problem, and they can immediately solve that problem. So that is about the quality and manufacturing. And when it comes to marketing also, today, like companies are spending huge money, particularly in pharmaceutical marketing, by employing thousands of field force, and they're going and meeting doctors and thousands of doctors. We do not know which doctor actually needs this drug. He actually, it appeals to him. We do not know. We just go on meeting these doctors, hundreds, each territory there'll be some set of doctors who are identified, and you go on wasting your time. With the application of AI, so we will be able to understand the customer expectations and doctor expectations and their actual pain points, So we will be able to accordingly optimize the deployment of the field force and the communication strategy. So that is what actually is another major area for pharma in marketing, improving the productivity in marketing. Because why pharmaceutical companies, products are very expensive for two reasons. One is the research. They spend huge money on research and particularly clinical development. And the second is marketing. If the marketing can be made more effective, the pharmaceutical product pricing can be drastically affected. Okay, so this is the other area where I see the opportunity for AI. Yeah, so finally coming to this particular cough syrup incident, I think this incident is not because of the pharmacovigilance failure. It is basically it was a kind of lapse in the regulatory monitoring. Though the regulatory rules are framed, but there was a little lapse in the monitoring, and that is how the government of India has stepped up the regulatory monitoring now. So now every material, all these, there are about 10 high-risk excipients which were identified, which are known to have these impurities called DEG and EEG. So this ethylene glycol and diethylene glycol. So now they are monitored right from the manufacturer to the, the dealer to the, again, formulation manufacturer, how much it is consumed, how much it is held in the stores. And then the distribution, supply chain is going to be monitored. So now now we can also use AI and blockchain technologies in the supply chain to improve the transparency and the actual movement of the product. That is what will actually minimize this risk. And also some, those spurious drugs. In our country, we still have this challenge of spurious drugs. Sometimes the original manufacturer product might be good, but then somebody else on that same name, will try to push the product. So that is another risk. So that is where again the AI should be used. So I think all in all, I see AI has got a huge opportunity for application in pharma, entire spectrum of pharma operations, to all the domains. So we, as a company, of course, we are not a very large company. We are a medium-sized company. So we are trying to work on some use cases, and we are now initially working on HR, training, learning, learning and development, marketing. These areas we are using, and of course, the discovery space and drug development, we are already using some tools.
Right.
The clinical development is something that we will take.
Thank you.
Thank you.
Thanks, Ramabu. So the message is clear. It's work in progress, big time work in progress. We are all learning. We should all be humble. That's why I started with that quote which talks about learning, and we should be humble enough to accept that something went wrong and we take accountability, responsibility. All three of you mentioned that. So now in the remaining time that we have, maybe we'll conclude this as the conveners mentioned to me around 1:05, 1:10. So we'll go through some common points, and it's like a bit of rapid fire, and give your honest thoughts, objective thoughts on this. So I'll start with the same thing. Having heard all of you about the need for security, regulatory, etc., I think everyone in the audience also understands the importance. It's a double-edged sword. Where do you balance, the need for growth versus the need for patient safety-based security? So we don't need separate law for artificial intelligence, experts panel. Of course, experts panels we have seen in the past review even in GSTs and do a lot of positive changes. So Atantra, let me start with you. What do you think on this? Do you think that we will not need any separate law for AI, or vis-a-vis what you just heard Rambabu, that even in pharma, there are so many areas, he went through some deep details about the process. And AI is, at least those are drugs, the medicine we can see and eat and take the medicines. Medtech equipment, you go and you can touch the CT scanner. Hospital, Digi Jatra, joy is going to start. I mean, that is very, we can all see it, feel it, touch it. AI, what is this AI? Chatbots, we don't see them, but we expect big things out of them. I'm trying to make it sound simple so that you can relate to it. So what are all three of you one by one response to, we don't need separate law for AI, experts panel?
So why do you think experts have come with this idea? What is the reason? Because in the neural networks, in the deep neural network, what is happening inside is still a black box. We know the outcome. Even the scientists are also trying to find out that what is really happening. Similar in the case of law also. I will give an example because you are a veteran medtech person in ultrasound, you have spent a lot of time. When in ultrasound this fetal infanticide came, and there were a lot of suggestions that we will mask the genitalia.
Good example.
Then in front of the regulatory body, the doctors are there, they are the experts. They told we have got thousands of views to find out. So there is no such effective tool to mask the genitalia of a fetus. Similarly, the AI has got millions of ways to breach the law.
Excellent.
So that's where the fallacy lies. Where are you going to pinpoint today there are two things. I think everybody else will agree that when we do a job and we love to do that, then we succeed. When you have passion. Same thing, if we love to do a quality job with an AI, we don't need any law. That is paramount. And if we come to an healthcare, if we are religious to take care of the patient, if we are thinking with our heart and soul to increase the care quotient of the patient, then nothing is required.
I think that's a great point. Since it's a bit of a rapid fire, I think that's a great point. There is re-emphasis of this every year. Today, director also mentioned, Dr. Ajit Parulekar also mentioned about the healthcare with a human touch. I think Joy also mentioned, we all mentioned, that I mentioned last year that I tried to search if there is any other business sector which has got the word care in its name itself. I couldn't find any, at least, even an AI search, right? So this is the only sector. I want to, it's like sharpening the saw, as per the famous leaders' 7 tools. Sharpening the saw. So this needs to be told and retold by all of you to your colleagues also, that this is the only sector where we don't have an inanimate object at the end of the chain. Value chain, supply chain, we can't call it a supply chain. Unlike all the other sectors, you have a mobile phone or a computer or cement or a coal. Here you have a human body, alive, agonized, in pain, surrounded by anxious relatives and friends, which is also important, as Joy would vouch for, that what happens when there is a agitation, for example. So all these are realities of healthcare sector, and therefore I think it's all the more important what you said just now, that if I may use a very standard word, self-regulation, listening to your conscience and translating that as future leaders in your respective domain of work, that is the solution. Other things will follow, including the experts panel, because they know also what Mr. Dasgupta mentioned. So, Rambabu, do you have anything to add to that?
Yeah, I will just.
Okay, please.
I just wanted to end my conversation with this, that 3 of us sitting over here, I think it is important for all of us to look at the patient activation part. Because today, we are concentrating more on the healthcare professionals, healthcare providers. We need to go one step beyond and look at the patient activation. I think that will resolve and solve most of the problems. Not all the problems, but most of the problems.
So Hinduja, Joy is doing this with the Digi Jatra itself,
No, the patient journey.
Great
That
example
is a great example.
Excellent.
Yeah, I think, I don't think we need any regulations for this. Because every time if we expect the government to regulate us, then it will become a burden of compliance. So there is a lot of compliance, and then it will also be painful for us. The self-regulation is the best mantra. So I would like to just give an analogy. So like, if a lot of accidents are happening on the road, accidents are happening. If the government comes up with a regulation of locking your speed, will you enjoy that? Instead, you better control your speed to avoid such accidents, right? That's a better thing, rather than, for everything we expect regulations to come, right? So that's how the industry, there is a lot of sensitization that is required, and the people who follow wrong paths will invariably experience the negative effects of that, and then they will learn out of it, right? So we don't need to worry much about the consequences of not having a regulation. So I think the best thing is that the people, it is by practice we have to, influence the people rather than, by power. So that's my view.
Absolutely.
Yeah.
Thank you. Joy?
Though I firmly believe there may not be requirement of separate law, but I'll give you an example. For so long, the healthcare sector remained unregulated, so-called. Nothing was governing. Certain clinical establishment act were active in certain states, but not
imposed in many states, not followed. Now, why I say this? Because we have used 3-4 words at the same breath. One is regulation, act, law, self-regulations. Now, if you see, beyond these first 3 words, there is a very thin line, and above that it comes ethics. Now, all of us are talking about when you behave in a very ethical environment and you practice ethics. But what happens when it goes to somebody who is going to use this in an unethical manner? Then your basic purpose of making it a human-centric, making it, patient-centric, or something which is for the benefit for the society, that goes away.
Absolutely, absolutely.
So, though it says that don't require, but I think at some point of time, we all love to be following that ethical thing and remain above it. But if somebody wants to violate, because a lot of movies and all you see, they bring the virus, bacteria, and they want to kill human civilization. So to prevent that, you need to have something. So similar
I
thing.
got your point, Joy. It's if I, as a healthcare stakeholder, want to sum up, I would say that ideal situation is we all follow our conscience, but this is my personal view, and I'm possibly synthesizing all of your views. That's ideal situation. The world is not ideal. The world of healthcare, definitely we all know, globally not ideal, and in our country also. Therefore, for the most important stakeholder in healthcare sector, which is the patients quality of treatment, safety, and all the associated things that they deserve as part of being a citizen, as part of also being a client to the hospitals, for example, or diagnostic, paying money. So there is a need for regulation, I think. And I think, Joy, you just brought out again a very practical, oft forgotten thing, that healthcare is a state subject in India. This is a very important thing, especially for the students, to need to remember. Where you work in future will also determine what you see around. Therefore, health being a state subject, the overall central laws and acts and policies are always formulated. Funds are given to the states, but it is up to the states, if I may say, which have the responsibility and final accountability to ensure the last mile, that is the patient, gets fair treatment. So I think it's a debate that we cannot resolve in one panel discussion, but net AI, which is even more unknown, if I may say, than a CT or AMR or high-level techno equipment. There is a need for even the lawmakers to get themselves acquainted with the implications, to have awareness. And I think an ideal situation will be, I'm mentioning to you because you are very active in the industry, for all of us to have joint advocacy so that the stakeholders, patients, advocacy bodies, deliverers, pharma leaders, medtech, everybody works together for the common cause, the patient, and agrees to formulate something which is not overbearing, but which is necessary for patient safety and quality. This is how I would like to summarize. At 12 o'clock, I think we are looking at finishing this nice discussion, but we'd like to touch base on the core audience of India's one of the most premier business management institutes, and in healthcare, in my opinion, top of the top. I think we can always learn and do more. So here are the students. Some of them will go to the industry in a few months. Many of them have already been placed, and they are being placed. And some are going to take a bit longer time because they are in first year. So for students, you all have been brilliant, successful, conscientious leaders of healthcare industry, and from all different kinds of important domains. What will be your message for tomorrow's leaders? And rapid fire, take you a few minutes and share your thoughts. as future leaders if they join your organization or Joy's or Ram Babu's?
So let me start. So my message to every one of you to recognize that change is the only constant. And in this technology-driven world, that will be the key. You have to adapt and adopt the change. That's how you have to look at the industry today. And have a boundaryless behavior. Don't limit yourself. It's not about technology or management. You have to learn a lot in order to be in this industry today. Because time is changing, technology is changing, environment is changing, and the ambience is also changing. So that's my
Excellent.
message.
Absolutely. Super. So change management, you disagreed rightly with the word revolution in the theme
Yeah.
of the, and I think, would you like to remind the word that you used to the students?
Yeah, that's I told.
In
it's a-
conclusion, I think that's a very good message.
Yeah, because we all know about mutation as a healthcare students, healthcare teachers, and healthcare professionals. So be mindful of the word, because revolution and evolution both has a progressive and retrogressive element to it, but not mutation.
Excellent. So professional leaders of tomorrow, or today I should say, please be ready for plunging into the industry with a mindset of change is a constant and it's mutation. So enjoy the change. Ram Babu?
Yeah, so my message to all of you is, I think whichever the industry you may join, medtech, pharma, or healthcare, but you should have one connect with the purpose of delivering the best care to the patient. So ultimately, all these industries are only serving the interest of those patients. If you are connected with that purpose and you are passionate about it, I think you will succeed in any role that you may be playing. It is not necessary that you are always in touch with the patients and then only you are, enjoying that purpose. So you can be anywhere in the system, but you should be connected with that purpose. So that is when, you will find it interesting. Okay, so have that passion for serving the patients. Thank you.
Thank you, Ram Babu. Joy?
Yes, I think both of them have touched upon two very important component. And when he spoke about purpose, I happened to hear TCS earlier MD Ramadurai. He told about purpose in your life. You need to know that what for you are here. So if I extend that partly, and if I borrow Anjanda's that initial thing of learning and not being taught, in your life you will come across, and I have seen in my own life, and I have seen many of my friends and subsequently colleagues, very often we get led by certain examples, certain directives, certain suggestions. What you do, what you love to do, please take that on yourself. Align yourself with that purpose, what you want to go ahead. Take that as your mission, and definitely whatever you do, wherever sector you go, you will do well. There is no shortcut, and at the same time, see what you are good, see what you want from your heart, and you make your heart to drive your brain, and that will be one of the best mix-up in your career.
Wonderful summary from the three of you. And I think if I was one of the students, I'd be very grateful for this messaging. We have Dr. Sujaykar's video with us, who could not be with us for health reason. So Professor Arif, is this the time? And after that, we will have some concluding things. Dr. Kaur had to cancel his trip at the last moment because he fell sick yesterday.
Good morning, everyone. Truly grateful for the invitation to, address the healthcare conclave at Goa Institute of Management. Good morning, everyone. Truly grateful for the invitation to, address the healthcare conclave at Goa Institute of Management. Unfortunately, because of some health issues, I've not been able to travel today, so I thought of setting out this small message through the video. I'm really thankful to the organizers to provide me this opportunity. Though I'm completely missing out on coming to your lovely state and city, and then of course to your very prestigious institution. I have been working at Apollo Hospitals for past 20 years and the past 8 years running labs which design, develop, and deploy clinical AI solutions. We have at this point of time close to about 50 ongoing projects where we look at 15 plus years of longitudinal data and then go about using machine learning, deep learning, generative AI in building solutions that are now getting embedded into not only our ecosystem, but several places, several healthcare systems across the world. And some of these, in fact, 20 of these are now certified algorithms going through regulatory processes in different countries. So I'll talk a little bit about, how do we design these solutions and how do we go about in deploying them. So one of the fundamental things around the designing of these, solutions are to ensure that you would need to have the right people in the room from the very beginning. And where the healthcare management, or for that matter, the entire management science comes into play, is that you would have to look at, number one, design thinking in terms of how you go about in designing the solutions, but do not forget about the systemic approach or the systems thinking approach that you would need to take into counter or look at various factors by which are in play, particularly when you are designing solutions for clinical use or clinical work streams. The other very important aspect is that how do you make your foundations of your data science appropriate, including good data engineering queries, how do you bring the data into fore, and then go about in machine learning activities. Also, an ethical approval, consenting is a very important perspective whenever you are going about in deploying the solutions. Now, how do physicians look at it, and how do healthcare systems perceive these, these solutions when you go about in deploying? In healthcare, in terms of the clinicians, you would see a lot of heterogeneous perceptions. And I call it heterogeneous perceptions because there are a few people who would go about in adopting them very early. And they are the ones who would advocate them for their prospective use. And there are people who will wait to get more real-world evidence before they go about in, using them in their work streams. And 5 years now into prospective use, we see that there are now people who are believing those AI systems, at least in the areas where we have deployed, and beginning to get the impact both in clinical outcomes and also in return of investment, which is a very important perspective when you are running these algorithms in an organization's perspective. However, too much dependence or reliance on AI systems can actually blunt the skills of clinicians. And we're seeing this. If you look at the Lancet's paper, gastroenterology paper, which came out last month, it actually shows that you might be de-skilling people in terms of the current systems that you're building, particularly the clinical decision supports. So it is imperative that you find solutions where you match the compute with cognition and build them together to have a collaborative interdependence in going about and doing the work that we want to do or get the best results out of both. And in that context, one of our latest research is around how do we build intelligent choice architectures, which gives you about a practical reasoning why you are taking a choice which will benefit the outcome, benefit the cost, benefit in terms of time to recovery, and of course, engage the patients in doing that. So those are the kind of attributes that you need to now begin to bring into your models and to your systems. How do you do that? I'll leave behind with another aspect, particularly from an organizational perspective, that when you roll this out in your organization and look for transformation, look at how you actually embed the culture of digital excellence within your institution. And in that, you would have to see what is your operative backbone. That is a very important concept, that what you commit digitally, you will have to fulfill physically going forward. And that's a very important notion to go about. Then how do you, when you collect the data, how do you go about in sharing the insights for the data for your patients or for your clinicians to make good decisions at the point of care? How do you then go about in improving and bringing more people to your platform by getting more network effects, positive network effects? And in doing so, the fourth important part is that you will need to do innovations. How important it is for your organization to actually balance between the autonomy and the alignment to the overall vision when you are going about and building the solutions. Fifth, and the other very important perspective, is that at some point you will have to take help from outside, bring third parties in building solutions for you. When to do it and when not to do it is something that you will need to have with strategic focus. And that comes from, one of the work of my guru, Professor Clayton Christensen, who looked at modularity between interdependence. Much more when I meet you in person, but thank you for this opportunity. And once again, very sorry that I could not make it in person. Anjanda, I will meet you very soon. And I hope you all have a fantastic conclave. Thank you very much.
That was a nice summary message. We appreciate. In conclusion, very short message from me. By now you know I love quotes. I love to learn from the greats. So those of you who like tennis, you would know who was Arthur Ashe, one of the all-time greats. He had this message for all the tennis players, which is one of the most highly complex and competitive sports. His message was very simple. Start where you are, use what you have, and do what you can. There is nothing beyond that for a leader. So especially in today's world, you heard from the three experts, very appropriate, very wonderful comments, which will be a guiding lighthouse for all of you students and all of us. So just do what you can do with the knowledge that you have acquired. And the other one that is from me, my favorite scientist, physicist, Albert Einstein. For those who say they have not made any mistake, they have not tried anything new. Now you heard all of them. Einstein said this: if anyone says I've not made any mistake in life, you have not tried anything new. We are entering an age, a saga in healthcare, global and Indian. You heard that from the experts, where there is high chance of making mistake, because every day you will face new things. And it's an exciting phase, according to me, from business leaders like you to start here. I wish I could start now and get into this exciting world. So I have a personal mantra to conclude this very nice panel conversation, and it sounds like copying from Albert Einstein. I have GH equal to C square I. GH, good health, very simple. C square I is commitment, collaboration, innovation. Without commitment, you heard that from all of them, no leader can move forward, can guide the team, won't get the respect of the team or the customers. Second C, collaboration. Healthcare is a very team game. We can't do anything solo. All these three gentlemen and many more, at least 6, 7 I can think of, are parts of the whole. Different segments and domains which make ultimately the patient heal and recover. So collaboration between organizations. So in every which way, think to collaborate, work as a team. And lastly, innovation. I won't elaborate that. It was obvious from all the discussions that we had. I thank the very, very eminent and experienced panelists for giving me joy and to the audience joy and a lot of good content in how AI and high tech can contribute something to this revolution and Atantra, revolution and mutation. So we are entering the age of mutation. I think, Professor Arif, we can have a couple of questions from the audience if they want. Quick questions. If anybody has. Please raise hand and shoot. Yes, you. Please tell your name, which year. Just use the mic, please.
Okay, so I'm Renalini Chaudhary and I'm from second year. So my question was regarding the use of AI in drug discovery. So right now we are seeing that in terms of computer-aided drug designing and drug discovery, we are using a lot of AI. But AI is based on the research that is already done. The base is that. So don't you think somewhere down the line, the new discoveries that are going to happen is not of a great quality as well as it is getting hindered over the time?
Rambabu, a quick one because of time.
Yeah. So that's absolutely right. Whatever is available in the public domain, published source, so that is what AI can actually capture and analyze it for you. So the new data has to be, again, we have to provide to the system. So whatever that but most of the time we want to use the data, but we don't want to provide the data to the system. So all pharmaceutical companies, they want to keep their invention secret, but they want to take it from published sources. So usually today, whatever is the academic institutions which are generating the data, that data only is available. But the actual pharmaceutical companies, whatever the data they are generating, it's not available to AI. So unless that happens, so then you will not get the real great insights from AI.
So Mrinalini, right? Time will tell.
Yes.
You are plunging into the world of change.
Yes.
You won't have the answer when you step out of gym into the industry.
Yes.
You find the answers. And that's exciting. One more question, please. Yes?
Hello, sir. Dr. Karnal from HCM2. So my question is regarding the role or the power of partnership. What we are seeing right now, and what's the better panel to discuss about the role of partnership where we have medtech, pharma, and hospitals.
Can I ask Joy
yeah.
So
when you say partnership, you mean?
So the role of partnership, as in we are seeing like Garmin has partnership with Apollo for the wearables, and Roche has also partnered with the 10 government hospitals for clinical trials.
Yeah.
So my questions is regarding, what do you think about this role of partnership in the democratization and the digitalization of the data quality, and how the data has been transforming the healthcare?
So you are saying that when organizations collaborate, partner, there are two different entities, two different,
Yes.
Yes. How will you ensure data quality, etc.? Big question, quick answer from Joy.
So first is collaboration. I think without that we can't have, and one of the things which came up very clearly that in this healthcare ecosystem, all the stakeholders needs to work. And two examples I'll give you from Hinduja side. One is when I mentioned about Doxper, that Inform DS, we are the first partner for them to roll out in India. So they came forward and they tied up. The second one I'll give you about that Ognito. So we are also one of the, they are doing the things in multiple hospitals at a time, and we are one of them. Now coming to your thing that how do you ensure that? of course, there has to be trust. You need to see the kind of people who are there on the other side, whether they are trustworthy to work with them. You need to have the legal framework to be created to safeguard your interest. And in that way, you can start working. But nevertheless, we have seen in best of the best cases also, there is data leak, there is a breach of trust. So it is also certain times your matter of luck that how much you can depend, how much you can rely, at what extent you can open up to them, and at what extent you needs to go ahead in your journey. So it is a trial and error. If you fail in most of the cases, then your tools are not correct to identify your partner. But if it goes well in most of the cases, maybe you have something in place. But definitely a strong regulatory framework you have to, not regulatory, legal framework you have to create that.
Thank you. I think every good thing has to come to an end. It was a fascinating conversation. Thank you very much. And thank you, the audience. And good luck to all the students here. Thank you.
Thank you, sir. Sir. What a truly illuminating discussion. Thank you to our panelists for sharing your expertise and your lived experience in navigating the complexities of technological transformation in healthcare. Your expertise has given us much to reflect on as we consider the evolving relationship between technology, research, and patient care. Thank you to Mr. Bose for his masterful moderation, Dr. Das Gupta, Mr. Ram Babu, and Mr. Chakrabarti. We are grateful for your candor, your insights, and your commitment to advancing patient care through innovation. And also, thank you to Dr. Kerr for being kind enough to share his thoughts virtually. I now request Mr. Bose to kindly felicitate our panelists.
Pleasure.
I request Dr. Das Gupta to please come forward.
Absolute pleasure.
I request Mr. Ram Babu to please come forward. I request Mr. Chakrabarti to please come forward. May I now request Professor Praveen Pradeep to please join us on stage to felicitate Mr. Bose, the moderator of the panel. Thank you, sir. I request all the dignitaries to please remain on stage for a group photograph. Thank you, sir.
Thank you.
Thank you. Thank you. We will now break for lunch. I request the respective volunteers to kindly escort the dignitaries to the multipurpose hall for lunch. And everybody is requested to reassemble in the auditorium by 2:25 for our second panel discussion.
I request everyone to please take your seats. We'll soon be starting with our panel 2 discussion. Welcome back, everyone. I hope you have had a nourishing break and are ready for our next exploration. Our second panel addresses what may be healthcare's defining challenge, not just what we can achieve, but who can access it. The panel is titled Democratization of Healthcare, Innovative Models and Technological Advancement for Universal Access. I invite on stage the esteemed speakers and the moderator of the panel. Dr. Ajay Bakshi, co-founder and CEO of Neurons AI Technologies. Dr. Siva Teja Kakileti, founding member, principal research scientist and director at Niramai. Dr. Devanand Kolotori, co-founder and executive director of Nexteni Tech Private Limited. Professor Shubhendra Sharvadhikari, CMIO at HealthTech. And Professor Arif Raza, associate professor, Healthcare Management at GIM. Our panelists represent a fascinating cross-section of innovation. For our first panelist, we are honored to welcome a visionary leader, Dr. Ajay Bakshi. A former neurosurgeon, neuroscientist, and McKinsey consultant, Dr. Bakshi has led some of India's top healthcare organizations, including Max Healthcare, Manipal Hospitals, and AIHH Parkway Hospitals as CEO. He is the co-founder and CEO of Neurons AI, a pioneering company at the intersection of neuroscience and artificial intelligence. An alumnus of AIIMS New Delhi and the Wharton School, University of Pennsylvania, Dr. Bakshi brings deep expertise in governance, ethics, and innovation. He also volunteers with iSpirit, advises EQT and Novo Holdings, and serves as an independent director on the boards of Livasa Hospitals and Nephroplus. Next, joining us today is a brilliant innovator in healthcare, Dr. Siva Teja Kakileti. With over a decade of experience pioneering AI-driven affordable healthcare technologies with early disease detection, particularly in resource-constrained regions, Dr. Kakileti serves as a founding member and principal research scientist at Niramai. His work spans women's health, COVID-19, diabetic foot, and eye diseases, now deployed across hospitals, government programs, and telemedicine platforms worldwide. A Forbes 30 under 30 India Asia honoree, Dr. Kakileti holds a PhD from Maastricht University, the Netherlands, and BTech from IIT Guwahati. He has authored over 30 international publications, contributed to multiple book chapters, and holds 30 granted patents across the US, India, Europe, Japan, and Singapore. For our next panelist, we are pleased to welcome a dynamic leader of healthcare transformation, Dr. Devanand Kolotori. He is the co-founder and executive director of Nexteni, a pioneering platform revolutionizing healthcare recruitment through AI-powered innovation. Dr. Devanand also serves as adjunct faculty at the Administrative Staff College of India, board member at the University of Hyderabad, and chairperson for Kaho, Telangana. With over 2 decades of leadership experience, he has previously served as regional CEO for Telangana and Andhra Pradesh at the SRDM Healthcare, overseeing 7 hospitals and labs. A frequent speaker at premier institutions including IIM Lucknow, IIT Hyderabad, and GIM, Dr. Devanand is known for his work in digital transformation, operational excellence, and ethical leadership. Next, we are delighted to welcome our distinguished pioneer in digital health, Professor Dr. Shubhendra Sarvadhikari. Dr. Sarvadhikari is a health informatics educationist and currently serves as chair of the LITD 35 Committee at the Bureau of Indian Standards and Chief Medical Information Officer at HealthTech. He also co-chairs at the Task Force on Artificial Intelligence for Healthcare at the National Academy of Medical Sciences, India. A fellow of the International Academy of Health Science Informatics and a TEDx speaker, Dr. Sarvadhikari has been associated with prestigious institutions such as IIHMR Delhi, IIT Kharagpur, and the National Health Portal, where he served as the first project director. With an MBBS from the University of Calcutta and a PhD in biomedical engineering from BHU, he has dedicated his career to integrating technology and medicine to strengthen healthcare systems. Moderating this crucial discussion is Professor Ari Preza, Associate Professor at the Goa Institute of Management and convener of today's conclave. Professor Ari Preza is an Associate Professor and Chairperson of the Outcome-Based Education System at the Goa Institute of Management. Holding a PhD in Healthcare Management, he brings over 18 years of diverse experience spanning academia and the healthcare industry. A recognized expert in healthcare delivery and systems quality, Professor Arif has been actively involved in consulting and advisory roles. He has led various funded research studies to help government in evidence-based policymaking. His work has been published in reputed journals and presented at several national and international forums. He also advises universities and educational institutions on strengthening teaching learning frameworks and serves on various industry association bodies to provide academic insights. Before joining academia, Professor Arif had a distinguished career in healthcare consulting, advising government and private organizations. He played a key role in achieving accreditation for India's first public hospital, a milestone in the country's healthcare history. He has authored 3 books on healthcare and has been honored twice as the best faculty in the healthcare management, reflecting his leadership and contribution to the field. It is a pleasure to have you all with us today, and we look forward to an insightful and engaging panel discussion. Professor Arif, I invite you to lead the discussion.
Thank you very much, and good afternoon, and welcome again to the second panel. Post-lunch session, as everyone knows that it's going to be tough on the panelists to keep everyone awake, as I could already see. There's a more empty seats now compared to the first half. Our job is going to be difficult to make sure that all of them are more engaged and actively participating into that. And with Anjanda blockbuster performance in the panel 1, you have set the benchmark even higher for all of us. So let us try and keep up to the expectation. First of all, it's my privilege to welcome you all at this particular forum to discuss such an important topic of democratization in healthcare, innovative models and technological advancement for universal access. We all know that healthcare stands at a precipice of possibilities and purpose, and it has been a long drawn aspiration for all of us for a truly universal access to basic quality or good quality healthcare. Which looked very difficult. We all understand about the iron triangle of cost, access, quality, and it has been so difficult to break the iron triangle. But with the newer models coming up, business model as well as technology and now recently the AI, this aspiration doesn't seem more like an aspiration. It is very much a possibility and not like a distant possibility. It seems like a near possibility. However, how much of it is actually happening? What exactly is going on? Are we actually moving towards it, or more, how much of it is hype, how much of it is reality? That is something which we all keep discussing and wondering about. And earlier we used to talk about things like 20 years down the line or 30 years down the line. But the world is moving at such a fast pace that now we have to come and talk about 5 years down the line. And that is the reason why I chose this agenda of 2030, because we know that the amount of change that is happening every year is mind-boggling. And we need to have more such discussion, more such forums where we interact, the academia and the industry interact, the startups interact and let us know what exactly are happening and how our life and the patient life and the population in our country is going to shape up. Across India and the world, we see technology reshaping the healthcare delivery. We see telemedicine bringing specialists to the villages. We see digital health platforms enabling population-level coverages. We see AI enhancing diagnostic and clinical making capabilities. So there are a lot of things which we haven't thought of 5 years back is possibility. It is in fact really aware of it. Now, equally impactful are various partnership models that are happening between public and private, between startups and established hospital organization, between private innovators and our digital health players and the grassroots healthcare workers. So collaboration has become more of a reality, and it has been able to transfer the knowledge and techniques to each other, using which we are actually doing a lot of wonderful things. Still, there are a lot of challenges. It is not that, it is just the start, and there are many more complex things, challenging things which is yet to be overcome. There are issues related to inclusivity. We understand there are issues related to patients' trust, how much do the population trust on us, about the privacy, data privacy primarily, patient rights, legal issues. So you can name it. The list can keep going on as to how these things are going to be tackled if this universal access, leveraging it on technology, has to become a reality. I'm really excited to have you all over here because I have a lot to learn, and I'm sure my students have a lot to learn and understand as to how exactly these things are being tackled, what is going on, and I'm sure the profile of the panelists which he has read out right now, we all are very excited to hear from all of you. And before we start the panel discussion, I think just to involve the audience also in this discussion, maybe I would like to have my audience think, and especially the students and the delegates who have come over here, what do you think? You all know our panelists, you know their profile. So what are the things, or what are the points, what are the questions? Can you give 3 or 4 points that is your concern, you would like them to highlight upon, which will help the panel discussion anchor to the relevant topics that is being taught by the audience? You can just raise your hand and you can maybe ask right at the beginning, not towards the end, so that you feel more involved right from the beginning. Anjana, if you could have a question. Yes.
Hello, sir. I'm Sarvajit Ray from second year. So when we talk about democratization, we actually talk about how various economic strata can be, we can deliver the healthcare to various economic strata. We talk about accessibility, we talk about cost affordability, and on top of that, from a business side, I want my operational efficiency to be good because I want to deliver all this kind of things. So where are we moving forward, keeping all these factors in mind is something that I'm looking for.
Very good, sir. So we won't answer any question right now. These questions will be answered during our discussion because we know what are you looking forward to. Yes, more please, Yeah. Rashid.
Good afternoon. I'm Rashiv Tripathi from second year. I would be more interested in understanding what would be the business value that a company finds in providing innovative models for universal access beyond, let's say, a B2G contract. What are the innovative business models, and how is it a viably functional thing for a business to invest in innovative models for universal access?
Okay, yeah, so viable business model is something which students are more interested in. Go ahead. Okay, we will take 2 more and then we'll start our discussion. Exactly, yes.
Hello, sir. I'm Manish Goel from HCM first year. My question is, how democratization of healthcare is helping innovation in terms of making healthcare more accessible?
The other way around, how innovation helping democratization? Both ways, okay. Good. Last question.
Hello dignitaries, I am Shumon Thro from HCM first year. So my question is, like we have been hearing about the digital mission the ABDA mission that has been going on for decades now, and which has been the cry of the nation for the past decade or so. So how it has flared in the current situation, and how public and private partnerships are actually working in digitalizing the healthcare system of India. The entire diaspora and the current scenario would really help us understand the current situation and assess accordingly as future leaders.
Thank you. So now we have some sense of what kind of concerns are there in the audience mind, starting from public-private partnership to innovation to business model, and what are the technological things that are happening up. I think we can now begin more relevant panel discussion. I do have my set of questions. I think the questions are generic, so all of these concerns could easily be addressed. I request panelists to also cover these questions while your discussion. Also to remind that we'll have a hard stop at 3:40. We have Dr. Devi Shetty's talk post that, so keeping that time frame in mind. So let me first start. I would first like to have an opening remark from all my panelists. We understand that in Indian context, we talk a lot about democratization. But what does democratization of healthcare truly means to you? As we look ahead over the next 5 years, how do you foresee the access to quality healthcare to the masses, especially into the non-urban or non-affording population? So we can start with Dr. Bakshi, and we can go in.
So thank you for inviting me. It's a pleasure. I've learned already a lot from the morning discussions. I want to trigger your thinking on two dimensions. One is that when we say healthcare, I want to argue that most of it is not about health. Why is that? Amongst the students, please forgive the faculty, can any one of you even define what is health? What is the WHO definition of health? You're doing a program in HCM. Anybody? Just speak it out loudly. Excellent. So health is a state of complete physical, mental, and social well-being, and not mere absence of disease or infirmity, correct? All of care is about, once you have disease, I will take care of you. Tell me which of our industry models today promote physical fitness, mental well-being, or social well-being? Pharma does it? No. Hospitals do it. Pharma does it, but probably in a slightly different angle. Hospitals certainly don't do it. Medical devices are, when you have a knee osteoarthritis, I'll give you a knee implant. And what else? Government tries in different ways. So I think you keep asking about models. I want to open a discussion, especially in the younger audience. What is the model for physical, mental, and social well-being? What is the model? Do we have one today? You should think about it, because for sure the healthcare industry is not thinking about it. That's a very important aspect. And if you look at the statistics, more or less 80% of the people are generally healthy, within quotes I'm saying. Healthcare focuses on the remaining 20%. If I give you statistics, if I see 100 patients in an outpatient, typically only 3 or 4 of them will require an admission, an inpatient, right? But when we talk about healthcare industry, we talk about hospitals. How many hospitals, how many beds, how many surgeries, how many procedures? So that hospital piece is addressing a 3% of a 20%. So what about the remaining 97%? That's where health becomes much more important, and I'll talk about it as we go into innovation model. Some of my colleagues are also doing some interesting work on that. So that's one dimension I wanted to raise. The second dimension is democratization. Very easily thrown around word, but I think all of us sitting here in this subcontinent should feel proud. So democratization, in my interpretation, means true value of every individual, and recognizing that every individual has an equally valuable life journey, and therefore if there are some rights given to the top 20%, those rights are also to be given to the remaining 80%. So it's a what was in the 1800s defined as a liberal thought process. Nowadays liberal means very different. The word has mutated quite a lot, but the real meaning of, because in those days kings used to say king matters, Praja doesn't matter. So the whole idea of liberalism was king and praja are all same. So I think, so when you think about democratization, understand what your society is like. And I would argue that our society is one of the most inclusive, most respectful of individuals. If you listen to Dalai Lama, he says that there is no society on this earth that is as accepting as the Indian society. So I think there is something to be said about don't throw the word democratization in a Greek or American. They claim that they invented democracy. I'm not so sure. If you go back 4,000 years ago, there was much better. If you read, I was just recently reading the Ramayana. If you read the first 2-3 chapters of Ramayana, how the kings deal with the population, it is democracy, actually, right? So there is a deeper dive required in democratization word also. And the third part is something that I think I learned from the director's address today. I mean, it really stood out. And it answers a couple of questions that were asked. That the real innovation Indians are good at is lowering the cost while maintaining the quality. I think, sir, you said that. I'll give you live examples of that. I'm on the board of NephroPlus. NephroPlus does dialysis for around average price of $15 per session. In the US, that costs $400. The same NephroPlus, when it goes to Tashkent, they built a center in Tashkent, they're getting $50 per session. More or less the same cost structure. That's very interesting. Philippines, they're getting $60. They're going to get an account in Saudi Arabia soon. So the point is frugal innovation. You build world-class dialysis systems, which you can now take abroad. I was at an eye care ophthalmology conference yesterday, and I learned that there is an Indian a cataract replacement lens, which is a 199 rupees, right? A typical lens is 4,000-5,000 rupees. So I think that answers your question of, if you can build a 199 lens and be profitable on it, you will also have an opportunity to sell the same lens at 300, 500, 700, 1,000, right? So if you are succeeding in a successful innovation that can go to scale at an Indian democratized way, you also have the remaining 7 billion people ready to adopt that. So I think that is a unique gift we have. It's hard. It's really hard to do that innovation because of the triangle that you talked about. If you really lower cost, the quality goes down. So I think there is a lot of scope for innovation on that front. And since you are giving opening, I want to leave a parting thought for a lot of them. I know Niramai will come very soon. Or you know what, I'll hold that thought because I have some suggestions I want to give to the young innovators in the audience. I'll hold that till the rest of the panel comes through. So thank you for that.
Sure. Thank you. I think explained very beautifully. And Dr. Siva, I think you can also add your opening remark for the topic.
Definitely. Ajay sir has neatly covered all the important aspects. So first of all, thank you for inviting me. So what I would maybe touch upon is what is the current situation specifically in cancer that we have. So if you see in India, specifically the diseases that we detect are episodic in nature, in the sense that we detect only, the disease are, in their, this is very severe in nature, like they are symptomatic. That's when we detect. Even I think earlier speakers have also mentioned the same. So can anyone guess, like if the incidence of breast cancer is around 180,000, can anyone guess what is the mortality rate? Any guesses? Like if the incidence is 180,000 in 2024, how many people have survived this disease? What
You
is
can speak out from your place itself.
Yeah.
Or you can take a guess.
5 years. 5 years mortality.
Yes. Or even you can guess, like, if the last year's incidence is 180,000, how many people would have lost? Yeah. Yeah. 10,000 are living or what? Okay. Any other guesses? Okay. Yes. So it is around 1 lakh. So it's 50 to 60% mortality rate. So that is every alternate woman diagnosed with this disease are losing lives. So we had seen cases where people have come to the hospital when the lump size is around 8 centimeters. We can clearly see that there is a lump, there is a discharge, yet people don't come to the hospital. So we asked them what is the main source. We asked multiple patients, right, to understand what are the main reasons behind this. We found out that majority of them are coming from the rural India. And if you know, like in India, we're discussing like around 70% of the population resides in rural India. And for them to come to the city, right, pay the tests, then go back, right, it's a major challenge. They had to take one day off, and they had to bear the travel charges, then the equipment cost, because majority of the medical technology that we use are imported, and it costs significantly high. So it's a significant burden for them. So that's where our company, where specifically in breast cancer we're focusing, is how can we solve this, address this issue, right? Can we build something that, this technology can be available in PHCs, where they don't have to travel, so far, if they're living somewhere in rural area, they don't have to travel to Bangalore or Mumbai, to get potential treatment or potential diagnostic imaging equipment. Can we take it to them, right? So to me, that's more, the accessibility, right, and affordability, so that they can easily avail the service, and they don't have to worry about traveling. They can just go in the morning or evening and just have a quick test and come back. So I think that's what we want to see in 2030, where we don't want people losing their lives just because the technology is not accessible, not affordable, but we just want to identify in the early stages. Because just to give an example, for breast cancer, if we can detect in the early stages, the survival rates are greater than 98%. That is, we can cure the disease directly. So yet we are losing every alternate woman diagnosed with this disease. So that's what we want to change in the future, where we have to provide the service so that it's more accessible and we can detect in their early stages.
Thank you, Dr. Siva, and I think that's an amazing example that you shared about the cancer care, and staggering number of people who are dying because of lack of diagnostic, and this is an example of how universal care should look like. And also, just to the audience, you can't dare to doze off with this panel sitting over here, because you'll have questions coming up and we'll be expecting to the point answers, right? So keep thinking. And also, I'd like to remind that, the initial questions were just to start. We'll have time for you to ask more questions towards the end. So note down your concerns, your question, if you have, while we are discussing about it. Over to you, Dr. Devanand, in your experience, if you could share some.
So good afternoon, everyone, and thank you for having me here. So first of all, I want to ask, how many of you have gone to hospital? All of you have gone to hospital. As a patient? No, they were born in a hospital, obviously, yeah. So, as a patient? Quite a lot, yeah. And as a patient bystander? Oh, that also is huge. Yeah. So, when this topic was shared, right, I was really surprised on what to, discuss, because the topic itself is so exhaustive, right? But the word democracy itself, giving power to people, right, to elect, in a democratic country like India, we elect the leaders. How many of you have that power now to choose your health, or choose the quality of health that you are supposed to get? How many of you feel that? Do you have the power to choose the quality of healthcare that you deserve? You have? How many of you agree, please? You all agree that you have the right to choose the quality of healthcare that you deserve, right? But are you getting it? Are you getting it? How many agree? No one is agreeing. Oh. So that's exactly, see, one of the conference partner is Kaho. So today, even though my organization name was shown here, I'm representing Kaho here. Kaho is consortium of accredited healthcare organizations. So when we look at the statistics of worldwide healthcare, there are 2-3 specific statistics that come out. How many patients, Surya asked a question on how many mortality or how much is the mortality. I want to ask you, how many deaths worldwide happen due to error committed while delivering healthcare? Any guess? A year. How many deaths? No, how many deaths in terms of a number? How many deaths happen due to, 2-3 million. Okay. 50 lakhs. She's bang on actually. 3 million deaths happen a year. A year due to errors, medical errors. Means the quality of healthcare given to you was bad. You know what 3 million denotes? 30 lakhs, that's like a passenger flight getting crashed every day. Killing people, that number of people being killed every day with a passenger plane crashing. That's the number. 1 in 10 people across the globe are harmed when you seek healthcare. And that statistic go higher in low and middle income countries, which is 4 out of 10. Okay? So, when we say democratization of healthcare, we are saying that somebody who is in a metro, like Bangalore or Hyderabad or Chennai or Delhi, Mumbai, the same level of healthcare should be available for a person in Kurnool, Mysore may not be a good comparison, maybe Coorg, or you talk about some places in remote villages, remote places like in the northeast. It is not happening in India. So maybe I'm making a very pessimistic statement, even though India is very advanced in terms of the healthcare in metros. We can compete with any international market in terms of the healthcare quality that we provide. But the disparity between the quality of healthcare provided in a metro versus tier 2, tier 3 rural is huge, huge. I was actually sharing yesterday with a few of our friends. There was a friend of mine who works in the northeast zone. He called me 2 weeks back. He was in a village, a remote village, but there is no doctor for close to 400 kilometers. Not even a single doctor. So imagine that's the India that we are living. We are advanced in a lot of areas, but still that accessibility has not come in, and in fact the quality has not come in. Why the quality has not come in? Most of the hospitals, I used to represent 7 hospitals in Aster. Quality means getting accredited. That's what the notion now in the industry. Quality means you get accredited, you are having good quality. It should be the other way. You should be having good quality and you should get accredited. But it's like, I think there was a Kaho Con meeting where there was a session called Wo Panch Din. The session name was Wo Panch Din. Can you guess what it is? Wo Panch Din? Huh? Audit. NABH audit when it comes, that wo 5 din mein sab kuch jugad, all jugad happens. And you get an accreditation and you say that you are NABH, JCI, everything. 80 years JCI couldn't do it. Worldwide, this is a scenario. Unfortunately, So democratization of healthcare can definitely happen. Like you said, the director also mentioned, India is very good in doing that. I think, firms like Niramai has already started taking the access to the rural India. Lot more opportunities are there. So you people are the future of India. So you should come with more affordable, accessible, innovations which can really help the mass, which is ultimately the patients, patients or the common man, right? Anything you make should benefit the common man, because and 60 to 70% of these people live in the rurals, while 70% of our doctors live in metros. These are, you see, the disparities you see, right? 70% of doctors stay in metro, while 70% of our population live in rural. So where does the democratization happen? Unfortunately, sorry, I'm making a bit of negative statement. That's the reality. So we all work together. The future generation comes together. Obviously, there is a huge opportunity. So I leave it here. I think we'll discuss at a later stage. But Kaho has been an emerging voice in terms of supporting the institutions in terms of improving the quality, not getting accredited, in terms of improving the quality, in terms of capacity building, quality programs. Anyone can go to the Kaho website. A lot of resources, materials, data is available. You can all use, to understand healthcare better in terms of improving the quality. Thank you.
Thank you, Dr. Devanand, for giving a reality check on where do we stand. And that's what this conclave is also all about, that, where are we heading? Are we improving or not? Right? So I'm sure these problems are not easy to tackle. And there are examples how these things can be resolved. So we'll have more questions. Let's also hear from our final panelist, Professor Sarvadhikari. So over to you, sir.
Good afternoon, everyone, and thank you very much for inviting me here. So when we talk about democratization, actually it's another name for collaboration. Now, how does collaboration help? If you think of illness, and if you replace the I with we, it becomes wellness. It's as simple as that. But collaboration, again, when you are talking about healthcare, has not only to be multidisciplinary or interdisciplinary, but it should be transdisciplinary, where multiple disciplines work together with a common goal. And that's where, the innovation, technological advances can happen, which would help each and every individual. Now, why is technology important? In fact, this question often people ask, is AI going to replace the healthcare professionals? The answer is an emphatic no. But there's no doubt that the healthcare professionals who are not using AI or technology will definitely be replaced by the healthcare professionals who are using AI and technology. That is inevitable, whether we like it or not. AI is just like a tool, like stethoscope is a tool. So using it well, that's very important. Why? Where does technology help? Do you have any idea how quickly now the medical knowledge is doubling? In fact, in morning there was a slide related to this. I don't know, did any of you notice? How quickly do you think medical knowledge is doubling now? In how many years? How many decades? Any guess? Anyone? Any student? The knowledge that we have today will become double how soon or how late? 5 years. It's taking hardly 2 months. Just about 60 days or so. It's unbelievable, and therefore it's not possible for any human being to keep track. That's an obvious thing. Whereas if we look at technology, definitely they can keep track of it. And if it is used properly, again, then the moment the use comes in, like it's a knife, whether it's used for good purpose or bad purpose, then safety and ethical issues, all those things come in. But essentially technology is a tool, is a very powerful tool, which can enable healthcare delivery, all healthcare professionals, if it's used the proper way, and that is democratization. So you get better access, you get better quality of healthcare, and definitely the cost is reduced.
Thank you very much. We had the opening picture painted by each of the panelists, and now what I'll do is that you'll have some specific question directed to the specific panelist, and also keeping time in mind. We'll request panelists to enlighten us on these things. Also. My first question is on innovation and impact, and I'll like Dr. Ajay's view on that. We've seen a surge of innovation in technology, like AI-driven diagnostic, hybrid care model, home-based care models, right? Remote consulting, and so on. What among these, in your opinion, if I have to prioritize, ask you to prioritize that, which one is going to have highest impact or the biggest impact in the democratization? Would you be able to share that, these things seems to be having the biggest impact, while the others might just...
Can I give an honest answer? So, first, a caveat. So, I have been involved in innovation healthcare for almost 1995. As a surgeon, I was inventing new instruments for neurosurgery. Then, as a stem cell scientist, I was trying to do research in, regenerative medicine. And then, of course, in the technology space. My honest answer is none of the above. Why? Because I think the need is so great. Like I've said, if you separate out health and disease, first of all, there's almost zero innovation on health other than yoga and some breathing exercises which are floating around, and the motivated people have to go and find it. There is no delivery, there is no innovative delivery model there at all, right? And some of this is also recycled Indian stuff coming back to us from West, and then it becomes more respectable. Which is, I think they're not even scratched the surface. On healthcare, why I'm saying none of the above, I think what Niramai has done, we need 1,000 more Niramai. And it's taken them 10 years to do it, probably more, right? It's been a long journey for them. So I want to take this opportunity to also invite this group of young, thinking minds, that if after this course you are looking for a job, you're actually missing an opportunity. If I was rewinded back to, your stage, I would say, okay, let me find a problem in India that needs a solution. Let's say Kala-Azar. Do you know that tuberculosis, the last drug was created in 1955? After rifampicin, there has been no new real standalone drug for tuberculosis. The Americans are not going to solve tuberculosis. We have to do it. And so on and so forth. So there are 1,000 problems waiting for you. You have tools available to you, you have capital available to you, you have AI available to you, you have the confidence of being an Indian citizen who's supported in so many ways. That was not the case in my time. In my time, all my classmates went to the US because there was no real hospital where you could do good quality work in India. Now, I have run hospitals which are best in the world, right? And many of them, not just in one or two locations. So I think my answer is, this is what we have seen so far in innovative business models is really scratching the surface. We really need to set our visions higher, both on wellness, diagnostics, communication, treatments. There is a world waiting for us to be discovered. So let's not, I'm underwhelmed by telemedicine. I was talking to somebody, Dr. Nafiza, underwhelmed by telemedicine. I'm really underwhelmed by home care. I've run all of these businesses, and I don't think they're really innovative or effective yet. There is a lot more needs to be done.
Thank you. Thanks for sharing that honest view. We need to have a sense of reality also, right? Not just get carried away by whatever being seen in the popular media. I would also like to request Dr. Devanand, if you could also share the thoughts on, how these models are doing in your experience with Aster and now with your own organization and your association with different organizations.
I would partly agree to what Dr. Ajay said, but I feel as a developing country, we say that we have a good growth rate and all, but there have been a lot of positive things also coming from the government, especially the e-Sanjeevani, which I think Mr. Sudeep also mentioned about it. If my statistics is correct, I think about 20 crore consultations are done in e-Sanjeevani, and most of them are free consultations. Imagine a person who doesn't have an access, like I mentioned earlier, to a hospital. He gets at least a teleconsultation now through an e-Sanjeevani and with no money attached to it. So that, I think, is a beginning of something which is good that's going to come in. Second is on the Ayushman Bharat, the ABHA card, or the data portability that's government, which they're trying to bring in. Once the data can be ported between, see, for example, somebody from, say, Goa goes to some other place or moves some other place, your data can also be fetched there, from the hospital to hospital. It's a fantastic opportunity, because otherwise, you have to move around with bundles of files, right? So it's so difficult. Now it's become digital, but you go to a particular hospital, when you move to a different geography, how will you take your data? So that's, I think these are all steps which is actually shown very good results. But there are very small things also which make a lot of difference. To just give you an example, there is a product, Joy mentioned a lot of innovative concepts in the morning. So one thing which I had done, implemented in my hospital is a product called Best Doc, BESTDOC, okay? This product actually is a WhatsApp chatbot. In sense, patients do not have to even download any app. So when a patient gets admitted in a hospital, who do you think when they get admitted, say for example, they go to the room, right? Once you are all been to hospital, right? So when you get admitted, you go to a room and you don't find the pillow. You don't find the pillow in the room, patient room. Whom do you call? Nurse. And is that the nurse's job? No. So obviously it is putting a load on the nurse, and at the same time, the patient has a dissatisfaction also, right? So this app, what it does is basically when the patient gets admitted, it enrolls 2-3 people, patient, 2-3 bystanders, all into this program. They all get a WhatsApp message saying that I am your assistant in the hospital, you can ask me anything. So the moment they go to a room and they see a pillow issue, they can type in 18 languages. They can just type pillow, it will prompt, pillow not there, pillow not clean, it will prompt. So they click, it will go to the housekeeping manager or the facility manager who has to bring the pillow, get an OTP from the patient and close it. So two things happen. Nurse is not troubled with the unnecessary things which they have to do. Second, the department which is responsible is actually taking up the accountability. Third, patient is happy before they leave the hospital. So it's a small product, but it helps all the stakeholders. So there are a lot of such things are coming in. His product is a wonderful product, you know, extremely good. Niramai has done very good in terms of detecting the breast cancer. So a lot of such things have come in. There's another product which is on the care continuum program. So a lot of positives have come in, but maybe yes, it has not given that kind of a benefit to the society at this point of time. But in days to come, I am very optimistic that even though I made a lot of pessimistic statements in the beginning, but I think a lot of positive things are coming up in India. I think it'll take up a very positive shape later.
Thank you, thank you. So I'm sure, and I think the example you shared is quite interesting and something which is very common and very relevant to everyone who all go to the hospital. Yes, why should us get burdened unnecessarily? Moving on, let us also explore the little bit side of the affordability and the scale. As you said, Niramai, or the models or the telemedicine, we all know that we still have a long way to go. I'd like to know from Professor Saptendra, what do you think about the scalability? And the whole idea is about making it affordable, accessible. It cannot be without affordability. So do you think that these models or newer technologies can make it affordable for the population in general?
Yes,
do something more?
Yes, definitely we are progressing towards that, because India was suffering from what was well known as pilotitis. You have lots of successful pilot programs which have been successful over a small population. The moment you try to scale it up, it doesn't work. But now that thing is changing with this private-public partnership models and various co-investing models that's going on. The other thing which is very important, in fact, Dr. Devanand talked about, so interoperability, that's very important. And that's where scalability also is supported, like ABDM is using this ABHA. And ABDM is very keen on standards. So ABDM is following the National Digital Health Blueprint of 2019, where all the 35 standards we had recommended from the Ministry of Health and Family Welfare in December 2016 is there. Additionally, the HL7 Fire Release 4 is also there. And they are actually enforcing it. In fact, we have the HL7 fire profiles for ABDM. The ABDM profiles are available at the NRCS, that is the National Resource Center for EHS Standards, the website that is maintained by CDAC Pune. And that is available, and the profile-specific, India-specific profiles, which are required for ABDM. And that is being applied. So the application is now going in that NHCX, the National Health Claims Exchange, that has been formed by the ABDM. And already insurance companies are doing it. And in fact, the clearance is much faster. And because it is standards compliant. So it's interoperable, so that scaling part is taken care of. And definitely, it's becoming affordable because the payment is quick, reimbursement is quick. In fact, we have heard from many states, many hospitals, many states are actually trying to pull out of ABDM because of this delayed reimbursement and so on. So So standards can definitely help, and that is one of the core areas where I think we should definitely, even those who are going for the innovative product should look at, because then you can go global. The standards are global.
Standards are one of the core part of making it scalable. Thank you very much for sharing your views, and I would now like to talk to Dr. Siva, and I would request you to, based upon your experience with Niramai and the product that you have developed, which is actually helping so many women in our country, what do you think about the quality and the outcome of, and not just for your product, but in your experience with the other newer models which are coming up? Do we have to be concerned about the quality and outcome of care? Are they at par, or are they better, or is there something we need to be done to ensure that there's no compromise to the quality and outcome?
Yeah, I think that's a very good aspect, because garbage in is garbage out. For any of the AI models, if the data quality is not good, then we can't expect a good performance from the model. So if we talk about data quality, right, many times during the data quality, during the image captures, specifically in the medical imaging domain, many times whatever images that get captured, they are not of good quality. It could be the device malfunctioning, or it could be the lack of experience of the technician. There could be a lot of errors, which we have seen in our, I can give an example. When we were screening a participant, and we typically capture 5 images per subject, because we have to screen the entire, both the breast regions. And the process is that the technician labels each of these 5, the left side, left view, right view. And this is even common for even mammography also, right? Now, because when they capture the image, the right side of the technician is left breast for the patient. So let's say if the patient mislabels that, this view is right side. So instead of saying malignancy is on the right side, we say that malignancy is on the left side. So the implication of it is, instead of performing the diagnostic test on the left side, we do it on the right side, and we eventually miss the cancer, right? So data quality is crucial. And the other important aspect in general is that, we are seeing a lot of AI models, right? And if you talk about just tuberculosis, there are many companies coming up with different AI models, right? Now, a lot depend on how these models are trained. Because, we have seen scenarios where, because I'm just coming in terms of the data science view, if the models are trained on symptomatic population and you try to test it on general screening population, you would end up giving high risk score even for the screening population, right? Now, when we look at on paper, you might say that, okay, this model is good, this model is good. But how do you validate that, right? Because they might be trained on a different set of data, right? There could be bias in their results. And it's not the mistake of the company, because there are a lot of parameters. Like there are known parameters, like specifically again for breast cancer. We know that mammography AI, how much ever you develop, it won't work for dense tissue, right? That's a known thing. So that's a known caveat for the companies to solve. But there are many other unknowns, like as we discussed. There could be bias in the data collection, right? So I think that's where also is important, that's where we're also looking at how we have to give freedom to the patient also to choose between models, right? And how do you validate these kind of AI models, right? Because for the same problem, we have n number of companies addressing it. And now with GPT and all these things, even GPT is also, you can upload an image and you are getting the diagnosis, right? So how do you validate these kind of, what is the metrics that we can build in? And the other aspect is, as Devana sir has mentioned, right? We are seeing 2 to 3 million cases because of the medical errors. But my worry is because of the over-reliance of AI, we might see a lot of cases getting missed or misdiagnosed. Because a decade ago, I have seen, when we go to the doctors, they're very skeptical on using of AI because, how do we trust it? Now, people are over-relying on it. right? If the AI is saying that, okay, this is a abnormality, okay, I will not look at others, right? No, we are reaching that stage. So again, what type of model we take changes the accuracies, right? So I think quality is important, and how do we evaluate? I think that's where more regulations are coming in. We have to build up those. Again, ABDM and all these things would help us in getting the data and allowing us to evaluate on wide variety of data sets.
I'd like to add just one caveat. See, this is something which people tend to overlook, that the competitor of this artificial intelligence is not a higher or greater artificial intelligence. Actually, the competitor is this natural stupidity, and that we often overlook.
All right, so I think, I have a few more questions, but they seem to have been covered. There's one last question, and also I would just like to give a hint, heads up to the students that, after this, the floor will be yours. So please, keep your questions ready. I'd like to go back to Dr. Ajay, and I understand that, your views, and we need to still do a lot more, considering the situation we are into, our population, the inequitable distribution, and so on. But what about the infrastructure and the capacity? Do we have resources? Do we have infrastructural support? What kind of infrastructural support do you think would be required? Right? Are we limited by that also?
No, the physical infrastructure is improving. The number of hospitals, I now do a fair amount of work deep inside small towns in Uttar Pradesh. And I was in a clinic the other day in a town of 20,000 people. There was a large lab collection center. That's infrastructure. You can order a sophisticated lab test and get a result in a town of 20,000 people. That's very impressive, whatever they have done. Similarly, of course, pharmacies are everywhere, right? Quality of pharmacy is a question mark. So in terms of physical infrastructure, I have seen the evolution over the last 3-4 decades, and there is a very impressive improvement. In terms of people infrastructure also, I was seeing today 1.3 million doctors, right? So there's a dramatic improvement. Still there are shortages in nurses, significant shortages in technicians and say dialysis technicians, OT technicians, etc. But already there are efforts in, and these things take 7-10 years to improve, right? Because there's training time and you are in education, so you understand that. So I'm actually comfortable about that. I think the biggest opportunity we still haven't tapped. There was a question on digitalization of data, ABDM. I was very much involved in the creation of ABDM as an iSpirit volunteer. And I think there we have made good progress with the DPTP Act, which lays down as a law that the data of an individual is owned by the individual, which by the way is very revolutionary. That's not the case in the US, that's not the case in Europe, and that's certainly not the case in China. So there are 3 models, right? I mean, for your benefit, you should understand. In China, the data belongs to the government, CCP, right? US, the data belongs to the trillion-dollar companies. Europe says data belongs to nobody, no innovation possible. There's not a single innovative company coming out of Europe in the last 20 years since GDPR has been passed. So I think the India model, that the data belongs to the citizen, and and that is true democratization, how can that data then be used for the benefit of the citizen? That is how UPI is working, that is how these lending networks that are coming up, OCEN, you should understand. So when you see the progress, why I'm saying all this is, when you see the progress of DPI, digital public infrastructure, in the financial area, I feel that we have to do something similar in healthcare. A beginning has been made through ABDM. I'll give you a live example. When we were working there, and even at that time I was a CEO of Manipal Hospitals, there was a Karnataka Medical Council that had verified certificates of, say, gastroenterologists, because that's the process. You need to show your certificate before you're allowed to practice neurosurgery or gastroenterology. But as a CEO of Manipal, when I asked the question, how many gastroenterologists are there in Bangalore? No answer to anybody. Nobody had the data because it's lying in an Excel file deep inside some office in KMC. So what ABDM is trying to do is create a health facility registry, health professionals registry, HPR, HFR. These are now real, and it's not fully rolled out. So the 1.3 million doctors are not there. I think there are hardly 50 or 100,000. Maybe now the number has gone up to 200,000 doctors are on HPR today. That should change, right? We should have full digitalization of who is a doctor, who is authentic neurosurgeon, neurologist, whatever. Where do they practice? They should be available on a Google map, or even better, not on a Google map, on a Map My India map, right? In the spirit of Atmanirbharta. So I think the world recognizes that we have the largest amount of data. We have not yet used it. I was telling Dr. Nafisa that there is a cancer registry run by ICMR. They have 13 lakh patients' data. Each of that data form is 6 pages of detailed information. You must be familiar with that. Try getting the data out of ICMR. Impossible. I had long conversations, just not there. I was having a similar conversation about the insurance bureau. So I think we have a lot of data assets lying around. That's the infrastructure I hope we can improve, because that will spur this innovation that we are missing right now.
Thank you. I also like to, Dr. Devanand, to quickly add, since now you are dealing with healthcare human resources, and it's an most important resource for healthcare. And for long we've known that, we lack human resources, data shared, one radiologist per lakh population and so, and it's very skewed also. Is that changing? Is there anything that you're seeing which is happening in that space, or the problem still is as it is?
The problem is still the highly skilled are again resorting to, they're confined to certain areas. They are not willing to work in the underserved areas, or they go out of the country mostly. Lot of institutions have mushroomed with low quality education, and when we recruit healthcare workers for hospitals or pharmacies, labs, we find people whom we have to train from the basic levels. So they have completed a BSc nursing, but they don't know anything. They come to the hospital and then they get the actual training. So for the for the namesake, they have a certificate with them of BSc nursing, but they don't know. Unfortunately, but I'm not saying that every institute like that, but majority of institutes are like that. So that's why you see also upskilling institutes coming up. There are a lot of institutes which actually upskills the existing team. So now, when we see, one important thing I'll tell you, see, we have recently, with a few partners, we founded a company called Next20, which is into healthcare hiring, which is supported with AI. Now, for us, getting clients is very easy, actually. Getting clients are about 400 clients are already on board. But the problem, quality candidates are not available. Imagine, when India is such a populous country, where we have so many people coming out of the colleges every year. The rarest person to get in a hospital is the MBBS doctor. MBBS doctor is an extinct breed, actually. Sorry, I think some MBBS doctors will be here. How many other MBBS? I see. Most of them, what happens is that they come only as a part-time gap arrangement. Obviously their thoughts are to get a PG, so they don't come and work. So the junior level work becomes very tough. So similarly, there are a lot of skill gaps in any hospital. That's not improved, but I think it's progressing well with a lot of accreditation coming to education institutions also. I think there's a progress being made, but I think there's a huge challenge even now in terms of capacity building in India. So as such, CAHO, as an organization, we also help in the capacity building, upskilling, the existing hospital team in getting the real quality, not accreditation. Accreditation should be the outcome of the quality work that the hospital does. That's the theme. It's an NGO, so obviously, the motto is to bring in the best quality available to all the deserving class. So that's what CAHO stands for. And that's what I think has been the voice also. Now, when I say CAHO, it is not only about doctors or nurses. CAHO has different forums for engineers, see, a lot of people are otherwise neglected, right? Pharmacist, the engineer, when I say the biomedical engineers, maybe the facility engineers. So there is a lot of other healthcare workers who are not noticed otherwise, you know. So all those people are skilled, informed, made more aware of the healthcare quality that we have to provide to serve the class. So I think it's making a good beginning. I think progress will be made very soon. Yes.
Thank you. Thanks a lot. Quite a lot of information and ideas being shared. I have my question list are still there, but I'm cutting it short. I'm like now give the floor to the students. Just a reminder, quick question, short question. If you could direct it to the specific panelists, even better, right? And maybe the short answer to that. Right. Okay. So please raise your hands. Yeah, I'm sure if the initial questions are unanswered, you think that you need more information on that, you can repeat that also. Yeah, Mike, please to her.
A very good evening to all of you. I'm Dr. Shweta Kanekar from Directorate of Health Services. My question is to Sir. It's very heartening to know that you were a part of framing the ABDM guidelines. But as you said about the registries, the health professional and the health facility registry, we know that there is almost 100% saturation with regards to hospitals and healthcare professionals belonging to the public healthcare group. But we still see a lot of hesitancy with regards to onboarding on ABDM by the private practitioners as well as the hospitals. So why do you think this hesitancy is there? And since you were a part of the guidelines, what more could be done to ensure that everybody is on board on the Ayushman Bharat digital
Very good
mission?
question. So actually we debated this a lot. So public is because the government has put a danda, you have to register. There is no choice. So the government, doctors and government, even beyond doctors are also registering. So that's actually a good thing, and that accounts for the 20-30% compliance that is there. See, the private sector, the problem is the following, and I think it's a market failure. It's not a big problem, it is solvable. The problem is doctors are very busy. They don't see any benefit of doing it today. What is the value to a private doctor, a private cardiologist or a private neurologist? He says, why should I do it? To the public doctor, they'll say there is a rule of your employment. Your insurance reimbursements are not linked to it. So the one idea that we had floated at that time, we had even spoken to Google, was that, see, today most searches don't happen on Google, they happen on Google Maps. So if I have a twisted ankle, I'll say orthopedic surgeon near me. And will pop up a few results. Those are self-generated profiles by doctors. Some of them may end up being not even allopathic orthopedic surgeon. So I think there is a game to be played here where you have a ABDM sticker approved profile for all the HPR doctors on Google, allowing the doctor to say, I sit in this clinic from 4 p.m. to 6 p.m., Monday, Tuesday, whatever. So that gives them free advertisement on the doctor side, and from the patient side, it gives you free access to trusted doctor whose certificates have been verified. Therefore, this whole quack business, fake doctor business, this is a very big problem. As I said, I'm working in remote Uttar Pradesh. Half the doctors are not even doctors. And forget even BHMS. They're not even BHMS. They just open a shop and say, 50 rupees, 100 rupees, and they start seeing. So I think there is a small innovation required there, and the private professionals will find benefit because they'll start getting more footfalls, and so they become more known and their revenues go up, so they're very happy for it. At least that's the thought process.
So I'll add one more point, because I was operating hospitals till July 2025. Why maybe it's a very bad forum to mention this, and I don't know whether it's right to say also in this forum. ABDM is a fantastic, mission in terms of ensuring India, but the problem is that the tariffs are Britishers' time. You understand? So the tariff.
That is, I think, PMJY.
ABDM, you are saying that in terms of a private hospital coming into ABDM, you are saying, right?
Yeah. Onboarding onto the ABDM.
ABDM portal,
mission.
obviously Ayushman Bharat.
Digital mission.
Digital mission, when.
Yeah, it's different.
No, but otherwise, why a private hospital should come to ABDM? They have to provide the Ayushman.
have a repository. We want to have verified and validated hospitals so that in the future we will have interoperability.
But most of the private hospitals are already, I think, already on board.
No.
Not?
No, sir. There is a huge difference.
You're saying private doctors not coming into the registry?
Both.
Doctors and facilities.
Okay,
both,
okay.
Yeah, they have to
No,
register on our
so,
platform.
a lot of people actually see, for example, most of our hospitals also are registered in ABDM or PMJY, but what happens is that, say a surgeon, for example, like that's what he's mentioning, laparoscopic appendicectomy, if the hospital usual rates, so see, there should be some hook for the doctor also to come to these platforms, right? A laparoscopic appendicectomy, the tariff is something like, say, 90,000 for a normal hospital. This will be in Ayushman 30,000. So why I'm saying is, when this product as such should come in and doctor should come to the platform and register himself, volunteer and give his credentials, he'll say that I have already registered in Indian Medical Council, my data is already there, right? So I need not to come to another central government body. Most of the private hospitals, I think there are mandates now coming in where hospitals are getting registered to this portal. Yeah.
Thank you.
All right, so I think we'll have to stop now. I'm sure there are many questions, and we have a tea break after that, the final tea break, so we can continue the questioning over here. So thank you very much. We have another important talk scheduled. There has to be some, All right, so I think we have to wait while he joins online over here. Yeah. Hold on, I think we can just be seated. They just connect him over here. He'll come and join us, and then we can go and sit over there and listen to him. I think they're just trying to connect him and bring him on screen. He's already waiting for that.
I request all the dignitaries to please be seated. We'll have the felicitation after the keynote address.
Recording in progress. Recording stopped.
Can you also hear us? Okay, so with that, I think we are concluding our panel discussion. Thank you very much all, to all the audience for the patient listening and asking question. And a very big thank you to all the panel member over here for coming all the way down to our campus and sharing your insightful thoughts on the topic. Thank you very much. Hold on for a second. I think we have some people.
Thank you to our exceptional panel for a discussion that was both deeply analytical and profoundly hopeful. The models and approaches you have shared demonstrate that universal healthcare access is not merely an idealistic goal. It is an achievable reality when innovation is purposefully directed towards equity. To Professor Raza for skillfully navigating this complex terrain, to Dr. Bakshi, Dr. Kakileti, Dr. Kolotori, and Dr. Sarvadhikari, thank you for showing us not just the technological pathways, but the human commitment required to democratize healthcare. I now request Professor Arif to kindly felicitate our panelists. May I request Dr. Bakshi to please come forward and accept our token of appreciation. I request Dr. Kakileti to please come forward. I request Dr. Kolotori, please come forward. And I request Dr. Sarvadhikari to please come forward. May I now request Professor Ajay Vamadevan to please join us on stage to felicitate Professor Arif, the moderator of the panel. We may now proceed with the group photograph. I would request all the panelists to please stay back. To please stay back on the stage. We now come to a truly special moment in today's proceedings. Only few individuals have transformed Indian healthcare as profoundly as our next speaker. Through Narayana Health, he has demonstrated that world-class cardiac care need not be the privilege of the affluent. It can be a right accessible to all. It is with great privilege that we welcome one of the most visionary leaders in the global healthcare today, Dr. Devi Shetty, founder and chairman of Narayana Health. A world-renowned cardiac surgeon and healthcare reformer, Dr. Shetty has transformed the way India and the world perceives affordable and quality healthcare. Under his leadership, Narayana Health has grown into a network of 40 healthcare facilities with nearly 6,000 beds and has been featured as a case study by Harvard Business School and the Wall Street Journal for its innovative model of cost-efficient healthcare delivery. In collaboration with the government of Karnataka, Dr. Shetty pioneered the Yashaswini Micro Health Insurance Scheme, bringing healthcare access to over 3.4 million rural poor, a landmark initiative in public health. A recipient of Padma Bhushan, Padma Shri, and international honors like the Economist Innovative Award and the Nikkei Asia Prize, Dr. Shetty has also been awarded honorary doctorates from the Universities of Minnesota, IIT Madras, and IIT Kanpur. His life and work, featured in the acclaimed Netflix documentary The Surgeon's Cut, embody compassion, compassion, innovation, and visionary leadership. We are truly privileged to have Dr. Devi Shetty with us, a trailblazer whose mission to make world-class healthcare affordable for every individual continues to inspire millions around the globe. Dr. Shetty joins us today virtually due to prior professional commitments, but his insights will be no less impactful for the medium through which they are delivered. Please join me in welcoming Dr. Devi Shetty. Dr. Shetty, we are honored to have you with us today. We invite you to deliver the keynote address.
Thank you. Thank you so much for the opportunity. I would like to speak to you for a few minutes and then I'm happy to take any of your questions. I strongly believe that India will become the first country in the world to dissociate healthcare from wealth. India will prove to the world that the wealth of the nation or wealth of the family has nothing to do with the quality of healthcare its citizens will enjoy. And contrary to popular belief, it's going to happen in the next 5 to 10 years' time. Why I am so confident that India will transform the way healthcare is delivered to the common man. I just want you to listen to me for next few minutes about what are the changes happening in Indian healthcare which defies all the logics and expectations. Let's look at 3 countries, big countries, India, US, and China. And let's look at one surgery called cataract surgery, which is important for everyone. If you live long enough, you will need a cataract surgery. Let's look at the cataract surgery numbers and 3 countries. US does 3.5 million cataract surgeries a year. And China, which is about 4 to 5 times bigger than US, is expected to do 4 to 5 times more cataract surgeries. But China does 3.2 million cataract surgeries a year. China does less cataract surgeries than US. That means majority of the people who are blind in China, in rural China, unfortunately have accepted the fact that they'll remain blind throughout their life. It's because in China, there is no private entrepreneurship in healthcare. Hospitals are built and owned and managed by the government. There is no private entrepreneurship. Now let's come back to our country, India. You're all smart people, have gone to the business school. I just want to ask simple data. How many cataract surgeries are done in India, you think? India does 8.5 million cataract surgeries a year. India does more cataract surgeries than China, US, and almost all the European countries put together. How did this happen? This happened because about 35 years ago, ophthalmologists, that's eye doctors, got fed up of big Indian hospitals. They said, you're too expensive and our patients don't like to be treated in your big buildings. They went to the community. They rented houses. They converted the ground floor of the house as their clinic and the operation theater for cataract surgery. And they lived in the first floor. And whenever they had a cataract surgery, their spouse or the wife assisted them. They brought down the cost of cataract surgery to a level that anybody could afford. And they took cataract surgery to the community. And this is how India transformed the cataract surgery. And India will do the same thing with every aspect of healthcare delivery. hospitals will be unbundled and the healthcare will reach to the places where people are, rather than we building huge hospitals with phenomenal cost, people traveling for 1 day, 2 days to reach the hospital. Everything is going to change. Now, what are the foundation on which I claim that India will transform not only Indian healthcare, global healthcare? Who are the people delivering healthcare? Doctors, nurses, and technicians. These are the pillars of delivering healthcare. These are the professionals who are. Now, let's look at the number of doctors getting trained in India. We are 1.4 billion people. It took us 60 years to build 55,000 medical seats. It took 60 years, 55,000 medical seats. In the last 10 years, we added another 70,000 medical seats. Today we have over 1,25,000 or 1,23,000 medical seats in just 10 years. And our Prime Minister wants to add additional 70,000 medical seats in the next 5 years. Because India doesn't have the luxury to understand how many doctors we need in India. Because an American doctor will never work in England. An English doctor will never work in America. But the Indian doctor is very happy to work in any part of the world. So when we make strategy to develop medical manpower, we need to look at the global requirement. We can't look at Indian requirement. So it is very, very important that India produces huge number of doctors, nurses, and medical technicians. And it is a very good business strategy because just wanted to let you know, let me ask you a question. Which is the largest industry in the world? Is it oil industry which is the largest? Or is it technology, IT industry which is the largest, or automobile industry which is the largest? Okay, let me answer. Largest industry in the world is the healthcare industry with about $15 trillion. And agro industry, the food industry and the healthcare industry are more or less same. In fact, we spend more money on the food, healthcare than the food. IT industry, automobile, they are very small, $5-6 trillion. They are nothing compared to healthcare industry. But the beauty of healthcare industry, global healthcare industry, is we produce 25 million babies a year. The resources and the job opportunities we have is not simply sufficient to train them and give them a meaningful job. We need to look at the global market where our professionals have a higher market value. I will give you an example. We have a hospital in Cayman Island, which is very close to US. We have close to 200 odd nurses working in our hospital. And these nurses every month send home at least 1.5 lakh rupees. And they're only 23, 25-year-old. Tell me, which girl coming from a poor family from rural India at the age of 23, 25 is able to send home 1.5 lakh rupees? This is the only profession, that is the nursing profession. And everywhere across the world, there is shortage of nurses. So these are the opportunities we have. Apart from transforming our healthcare, these are the global opportunities we have. And of course, we are the pharmacy of the world. in terms of quantum of medicine produced across the world, we are the country which produces the largest amount of medicines. The other reason why I am very bullish on healthcare getting transformed in India is the power of technology. Digital platform will dramatically change the way healthcare is delivered. You're all aware of the electronic medical records, EMR. 80% of the hospitals across the world do not have electronic medical records. Simply they can't afford it. It's too expensive. As an organization, we have spent millions of dollars in building one of the world's most advanced digital platform. And today, if you enter our hospitals, we have reception where there is no receptionist. Patient register themselves, they pay online, or there are kiosks. Lot of the activities of the hospital is built on suggestions from the AI tools. When a blood test report comes, it comes along with the AI interpretation of the test report and what the AI agent thinks, what needs to be done. These are extremely sophisticated digital platforms. Our desire is that this should be available to any hospital in the planet at a price what they can afford to pay. And if they cannot afford to pay, it's okay, they can have it free of cost. We have given this our EMR, which is used in all the Sai Baba hospitals. And interestingly, one of the missionary hospital called Skada Memorial Hospital in Ranipet is using our EMR. And the CEO of the hospital was very happy after using it for a few months. It really transformed the way they were delivering healthcare. He wanted to thank me for giving them the EMR free of cost. And he asked me a question, why I gave them the EMR free of cost. I told him that if I ask him to pay, he won't have the money. But I asked him a counter question. I asked him, by giving him our EMR free of cost, have I become poorer? No, I haven't become poorer. If I didn't give him the EMR, will I become wealthier? No, I won't become wealthier. This is the power of converting atoms into bytes. I developed the EMR so that my patients can get the benefit, my doctors will enjoy caring for the patients. I can afford to give it to the whole world free of cost. I can still have what I have. It's exactly like if I have 1 kilo of rice, I give you half a kilo of my rice. I lost my half a kilo of rice. Whereas if I had developed the EMR with my money, I give it to everyone. I still have what I have. This is what will change the way healthcare is delivered in India, and this is how converting atoms into bytes in every aspect of our life will make this world a better place to live. The other interesting thing what will happen in India is that it is a matter of time before you will have thousands and thousands of diagnostic labs everywhere in the country, which will do your health screening within 60 minutes. You go to this health screening center, they will check take your history, take the blood sample, and they'll do the carotid Doppler, echocardiogram, ECG, abdominal ultrasound, CT scan of the heart, CT scan of the tummy, bone densitometry, mammogram, pap smear, everything within 60 to 90 minutes. This will become an annual affair. Now the question is, why healthy people should go for a preventive checkup every year? Unfortunately, people don't know that how fit they feel has nothing to do with how fit they are. If you want me to say that, if you want me to certify you as a fit person, I need to see your data. Without data, no doctor can say that you are a fit person. And today, the technological tools what is available, they give such good images of your vital organs that we can pick up diseases at a very, very, very early stage. Now, what is the implication? Every day in India, before 7 o'clock in the evening, few thousand people will develop heart attack. Maybe about 1 lakh people, we don't know. And 10% of them will die after the heart attack before they can reach the hospital. Every day before 7 o'clock in the evening, few thousand people will be diagnosed with end-stage cancer for which there is no cure and they are going to die. Go back 365 days, 1 year earlier. If all those people went to a diagnostic lab, got all the tests done, what I have just explained, none of them would have had a heart attack because the blockage would have been diagnosed and they would have been treated. None of them will be diagnosed with end-stage cancer. It will be early-stage cancer, which can be cured most of the time. Now, why this is important that healthy people should undergo preventive checkup? I just want you to, when I finish my talk, when you are on your way home, just Google FIFA, FIFA, Federation of International Football Association. Just say FIFA, then you write cardiac arrest. Then you see large number of articles written about the experience of cardiac arrest among the professional footballers. In the last 4 years, 617 professional footballers had a cardiac arrest during practice session. This is what is documented. We have no idea what is the undocumented incidence of cardiac arrest. That will be at least 5 to 10 times more than what is documented. Who can be fitter than a professional footballer? They are young, athletic. So if a professional footballer has a cardiac arrest in large numbers in just a matter of 4 years, what about you and me? So the only way you will detect all these healthcare problems are by going through a routine annual health checkup. And all these health checkups will be done outside the hospital in an environment which is very friendly, and it will be very inexpensive. The next big change, what will happen in delivering healthcare to everyone, is that health insurance will become affordable and accessible when hospitals become health insurance companies. thanks to new regulatory, reforms in regulations in India, we as a hospital group became first hospital group in India to become a health insurance company. Now, why hospitals should become a health insurance company? What is the problem with the existing health insurance delivery? There is a problem. There is a trust deficit. There are three important stakeholders in delivering healthcare. First one is the hospital, second one is the health insurance company, and the third one is the patient. Hospitals do not trust the health insurance company. Health insurance company doesn't trust the hospitals because hospitals always increase the price if the patient is insured. And the patient doesn't trust both parties, and those two parties don't trust the patient. So you have a situation wherein there are three important stakeholders who do not trust each other. In any business, if there are three important stakeholders who don't trust each other, that business cannot be scaled up. And this is what is exactly happening in healthcare. But when a hospital becomes a health insurance company, everything changes. Today, about 16% of the heart surgery done in India is done by us. More people develop heart attack, it is better for my business. But when I become a health insurance company, I will work very hard to make sure that nobody develops a heart attack, nobody has any advanced disease. That is the only way I can save money. Then my interest and the customer's interest is aligned. Then the magic will happen. This is the power of hospitals becoming health insurance companies. The other big shift which will happen is a health savings account introduction. Health savings, I'm not sure whether you are aware of the benefit of health savings account. Health savings account started in Singapore in 1984. Then subsequently, China adopted in large scale. 300 million urban workers in China have a health savings account. What is health savings account? Health savings account is a zero balance account like a Jan Dhan account. But the money deposited can be used only for paying the premium of health insurance or paying for the healthcare expenses in a hospital. So when this happens, millions of people will be, especially the gig workers, unorganized sector employees, everyone will be encouraged to open the health savings account, and a small amount of money comes from the employer, and especially for the gig workers, there will be people who are happy customers. When somebody delivers you ice cream at 10 o'clock at night, you are happy with the service, you can donate maybe 50 rupees or whatever to the person who delivered. Like this, there will be many, many avenues where the society will come forward. And in the end, there will be enough money to buy the health insurance, affordable health insurance for all these gig workers. When this happens, there will be millions of people who, instead of paying from their pocket, they will end up getting paid from the health insurance company. All these changes are in the making, and it is a matter of time. So I just want to end my talk stating that India is a fascinating country where dramatic changes will happen in the near future, and healthcare will be available to everyone. Thank you so much. I'm happy to answer any of your questions.
Thank you, Dr. Shetty. This is Ajit Parulekar. I'm the director of the institute. We were privileged to have you over a decade back when we just started this program in 2013. At that time, in the inaugural, you had given us, you had spoken to us at that point in time. And certainly India has changed, and the health and healthcare has changed in India over this decade, with so much happening from the government and, of course, so much happening from several organizations, including NH. Thank you so much for this. We can open up for some questions if there are any questions from the students. And Anjanda is also here. He thought he'll thank you in person, and then we could take some questions.
Joining us, and 20 minutes, everybody was spellbound. So thank you very much for sparing your valuable time. Thank you.
Thanks, Ajay.
We can take questions.
Very good evening, sir. In one of your interviews that you had given, sir, I had read that you had stated that in years to come, maybe 5 or 7 years, a doctor will have to take a second opinion from the software that he's using. And probably it would be legally mandated. I mean, I don't know, but this is what I had read, sir, that you had said a physician would have to take a second opinion. Now, how do you think, sir, this will envision, or what do you think, how it will change the doctor-patient relationship if this has to really happen?
Sure. That technology is already here. I keep saying that it will happen after 5 to 7 years' time, so that my colleagues won't shoot me down. The technology is already here, and in terms of today, the doctors who are treating patients, they have stopped enjoying the art of healing, predominantly because of the deluge of data points. Every patient comes with, in the ICU, has few hundred data points, so many blood test reports, so many images, and it constantly keeps changing. So it is very, very difficult for a doctor to decipher that many data in a busy hospital environment, whereas a AI agent can decipher it tirelessly and present the data to the doctor. In the end, it is the doctor who takes the decision. So we believe that with the introduction of technology and analytics, AI, medical error will be eliminated. Medical error is the third leading cause of death in US. So medical error will be eliminated. And the care given by a ordinary doctor and an extraordinary doctor will gradually get merged. Even the regular doctor will be able to perform like an extraordinary doctor with the data coming from the AI tools. But in the end, it is the doctor who makes the decision. These are the tools which are suggesting the doctor that this may be the possibility. Yeah.
Thank you, sir.
Any other questions? Dr. Shetty, I have a question, and my question was, we've had a lot of conversation today, and you yourself touched upon some of those points of conversation, which is, India is really known worldwide for, making healthcare a lot more affordable, whether it is whether it is the cataract surgery you spoke about, or whether it is, medical devices today, they're at a fraction of cost. Pharmaceuticals is the other example. So my question is, do you think, therefore, that is India going to have the same challenge that most nations, almost every nation in the world has had, where we are spending, it's difficult to contain the percentage of GDP you're spending on healthcare. We spend at around, roughly for the last decade, we've been spending roughly around 4%. Do you think we'll be able to get these outcomes you speak of in that 4%, or would it result in healthcare inflation? We would have to go to the 7-8% that is like the world average?
There will be a marginal increase in the payment, but the payment will happen with the large-scale health insurance program with the risk pooling, so that like we are in the process of launching a health insurance for the gig workers with a premium of around 3,500 rupees, which will cover the gig worker up to 3 lakh rupees. So all this, just imagine the quantum. If 100 million gig workers get health insurance by paying 3,500 rupees per year, and they are covered up to 3 lakh rupees, that means collectively they are covered for 30 lakh crore rupees, which is more than the annual budget of most of the countries. This is the strength India has by a very strong digital network which connects all of us, and the right policies. This is what will transform Indian healthcare. Individually, people will pay a very small amount of money to the insurance, but because we are a large nation, there will be a huge amount of money available to take care of the unfortunate few who will fall sick.
Thank you. Thank you so much, Dr. Shetty. Thank you for sparing your valuable time and inspiring our students, our faculty as well as speakers. Thank you so much.
Thank you. Thanks. Thank you.
As we come to the close of this remarkable day, it is not just the ideas and insights we carry forward, but the shared purpose that reunites us. Educators and learners, clinicians and innovators, policymakers and entrepreneurs, all working together towards healthier, more equitable future. I now have the privilege of inviting Professor Shirupa Sengupta, Program Chair of the Healthcare Management Program at GIM, to deliver the vote of thanks, not to mark as an ending, but the beginning of a continued dialogue, collaboration, and progress. Dr. Sengupta brings over 15 years of experience spanning academia, industry, and the development sector. Her teaching and research lie at the intersection of health, gender, and public policy, areas where she has led several impactful projects supported by UN Women, UNICEF, German Institute of Development and Sustainability, the Ministry of Women and Child Development, and the National Commission for Women. Professor Sengupta, please share your closing thoughts.
Good afternoon, everyone. It's been a very exciting day, and what fantastic speakers we've heard. A lot of hope, skepticism, debate, all were packed since the morning into all the deliberations that we've had. We would now be closing this day. This is a little bit of a different kind of a vote of thanks, while it comes as, of course, showing the gratitude to all our speakers and a lot of other people who have helped us. But in this vote of thanks, I'll also take the opportunity to make a few announcements, and it's also a call for collaboration. So let me just start with the usual vote of thanks, and I'll end with more good news, and of course a call for collaborative efforts. So once again, good afternoon, As we come to this closing of the inspiring day, it is indeed a privilege and pleasure to deliver the vote of thanks on behalf of the Goa Institute of Management. At the outset, I extend our heartfelt gratitude to all our distinguished speakers and panelists who made the 6th annual Healthcare Management Conclave very, very exciting and definitely very enriching. We're deeply thankful to Mr. Joy Chakravarti, Mr. Swadeep Singh for their thought-provoking plenary addresses, setting the tone for today's deliberations on the future of healthcare. We are extremely grateful to Dr. Devi Shetty for his keynote address, which was both visionary and extremely inspiring. A special word of appreciation to all our eminent experts for our 2 panel discussions. It was indeed a pleasure to listen to them for sharing their valuable insights on AI, on advanced technologies, on innovative models, and what particularly struck in both the panels were the continuous emphasis on equity, fairness, and inclusivity for making healthcare more accessible and equitable. Your experiences have broadened our understanding of what Healthcare 2030 could look like. A round of applause once again for all our esteemed speakers. Such enriching discussions are not possible if you don't have the right person to orchestrate. I extend a special thanks to our incredible moderators, Mr. Ranjan Bose and Professor Arif Raza, for creating the perfect platform for meaningful exchange. I think they also deserve a round of applause. A sincere thanks to Professor Ajit Parulekar, Director of GIM, for his continued leadership and support. And thank you for once again, not only for the way the event stands today, but constantly questioning, pushing us to think beyond the obvious that we read, research, and deliberate. So thank you for that inspiration. I thank my colleague, Professor Kea, for sharing the HCM research and for launching the Center for Health Systems Design and Management. A step forward in GIM's commitment to healthcare innovation, and I do extend a call that already Professor Kea has made. We really look forward to collaborations in terms of capacity building, research, and other programs that we can do together. So it's a shout out to all our partners who are present now. We acknowledge our valued collaborators, CAHO and India AI Mission, for their partnership and support in organizing this conclave. I extend our appreciation to all our partners whose support has been crucial to the success of this event. This is a little bit of a long list. I thank our IT team, Ashley, who's our outbound program manager, Celine, our front desk associate, who helped us with accommodation and travel, Serena Vaishnavi, our academic associates, Sienna, from the HCM office, Raju from K-Star for the hospitality, Dhanesh, our deputy manager estate, Mr. Jay Kumar, our senior technical manager, and Arvind and his team for travel support, EcoClean staff, and of course Taj Vivanta. This vote of thanks is incomplete without extending a heartfelt thank you to all the student volunteers from first and second year who've been an integral part of the conclave. A special thank you to all of you for your commitment for ensuring the seamless execution of this event, and also on behalf of the organizing committee, I appreciate all your efforts and support towards making this conclave successful. Please give them a round of applause. Warm thanks to all the delegates, to faculty, to students, to other organizing team members whose efforts made today's event a success. But as I said before I conclude, I'm delighted to share that the healthcare management program at GIM is expanding its scope to respond to the evolving needs of the healthcare ecosystem. So from 60, we are going to 120, and well, I can see Sean smiling, but then with growth comes a lot of challenges. As we grow, we warmly invite our industry partners, healthcare organizations, policymakers to collaborate with us through student projects, we seek your support for student projects, summer internships, live case studies, and joint research initiatives. Your continued engagement will help us, my colleagues, our scholars gain hands-on experience and contribute to this evidence-based solutions for the sector. Thank you all for joining us, for your engagement and enthusiasm, and we look forward to meeting you again next year with yet another exciting topic, and I'm sure by then AI would have solved a lot that we are facing today, some of the challenges, and we would have had better results in terms of ensuring fairness, justice, and equity. Thank you so much, and have a great weekend.